home and being in a long-term care facility that's experiencing that. You know, ultimately, we say home is what you make of it. And in this situation, when it comes to disrupting long-term care, it's about giving people the ability to make their home. What has happened in terms of disinvestment, particularly on the South Side, has been brutal, and it's impacting us on both sides of the life spectrum. That the early childhood side, and in terms of our older senior populations. And we have decided to say, like, some people are deserving of more investment than others, and this goes in a holistic approach. If you can't get to point A to point B, if the people in your home are working multiple jobs and are exhausted and they're not getting paid what they need to get paid, if a grocery store in your community is being closed down and your access to food is limited, if you're not making the type of investments in terms of accessibility in the community so that people can walk, or if they're they have support and they're not able to get from one part of a sidewalk to another. These are all, in my belief, fundamentally public safety issues, because if you create pressures on any parts of working class people's lives, it has an impact on other parts of their life, and it can actually cause the wrong type of disruption. And so fundamentally, what we need to do is make strong investments in a holistic level of care that includes infrastructure, that includes goods and services, and that includes equity. If we don't do that, we're going to just keep being in the same old crisis over and over again. And, Chicago is known for its segregation, and I think this is one way for us to actually move away from such painful, brutal segregation. And as we move into 2022, when it comes to the state and where we're at with funding, the hopes that can come out of DC, we have a real opportunity to actually bring fairness and dignity to people's lives, inside and outside their home. In order for us to change this dynamic, in order to bring that fairness and dignity to people's lives, in order to expand public safety beyond just a few people, but to everybody in every corner, in every zip code in Illinois, it has to be led by truly outside pressure. And what I mean by that is there are some of us who do this work on the inside, but what drives us and push us are the volunteers, the organizers, the advocates, who give us a vision of what they need in their community. And our job is to be able to carry that in Springfield, to carry that under the dome. And so as we head into next year, I urge everybody to reach out to legislators such as myself, to demand change, and to understand that you are the voice and the power that is able to push these ideas and make it possible. Without organizing, without pushing, change rarely ever happens. And so keep on doing that. Keep applying pressure. Make those strong demands. I mean, I'll finish this by saying we always quote Frederick Douglass: "Power concedes nothing without a demand," and that wasn't just an empty statement. It was literally about making tough, bold demands, making them clear, and it coming from the community most impacted by whatever crisis is going on. And so in this situation of disrupting long-term care, push power by making those demands and advocating in Springfield.
Good morning. Hello and welcome. My name is David Olson, and I'm the Director of State Affairs at the Alzheimer's Association Illinois chapter. I'd like to welcome you to this important live virtual Disrupt Long-Term Care Summit. You're joining us for our first session, The Real Solution: Home and Community-Based Services. Today's live virtual Disrupt Long-Term Care Summit would not be possible without the collaboration of the four amazing organizations that have joined together in coalition: SEIU, Access Living, Alzheimer's Association Illinois Chapter, and AARP Illinois. If you'd like to ask a question anytime during this live summit session, please post your question or comment in the chat box below, and we'll be addressing comments and questions throughout the session. Today we are on live with esteemed leaders from state government, aging service providers, advocacy organizations, and I'm really honored to welcome today's panel. We have Senator Ram Villavalam, Director Paula Basta of the Illinois Department on Aging, Deputy Director Laura McCurdy of the Illinois Department on Aging, Carol Aronson, Director of Social Services Division, Shawnee Health Service, Amber Smock, the Director of Advocacy for Access Living, and Marla Franzak, Chief Executive Officer for Age Guide. To read more about our incredible panelists, please click the bio link in below. It's that link with a little person, and you can read more about their bios. And throughout the session, we have handouts available. If you click on the documents below, there's two pieces of paper. That is the handouts for session 1 there to download some key resources the coalition has made available. The Illinois Disrupt Long-Term Care Coalition is advocating to rebalance the state's long-term care system. The state of Illinois must provide adequate long-term care services across the spectrum of care, with appropriate services which are accessible to any resident depending on their level of need. Reshaping how we age and live with disabilities in our state with independence and dignity relies heavily on a well-developed array of home and community-based services, as well as the support of our state's family caregivers. Alongside my esteemed panelists, over the next hour, we're going to take a deeper dive on how to improve and expand our existing home and community-based services, as well as opportunities to further support our state's unpaid family caregivers, as well as those important paid caregivers in various facilities. So without further ado, I'd like to bring in our panelists, and we can begin the discussion. Welcome, panel. It's great to see you. We're so thrilled to have each one of you here with us today, and with all the viewers across Illinois. So I'd like to first turn to a question that is a little bit more high level. So before we get into some of those specific details of home and community-based services and their delivery in Illinois, we know that 70% of adults who survive to age 65 will develop severe home services needs. We often talk about how important home and community-based services are, but they are at times much less visible than residential care, like nursing homes or assisted living facilities. Why is it so important that we have a robust home and community-based services infrastructure for seniors and people with disabilities? And I know this is something that every one of the panelists could talk to, but Amber, I'd like to turn to you first to answer this question.
This is Amber from Access Living. I'll give it just a first shot. I mean, the very first thing I have to say is you just heard Mary Matthews talk about what she experienced in a nursing home. That's bottom line. And what she experienced, that she is not alone. Access Living and other groups work with Mary Matthews to advocate for herself and get out of the nursing home. And I think people underestimate how much work it really takes to get someone out of a nursing home. It's far less work to transition someone out of a nursing home than to keep them in the community. And for decades, people with disabilities and seniors have been saying to anyone who will listen, I'd rather stay in my own home. I'd rather stay in my neighborhood. I'd like to stay where I grew up. I'd like to stay with my family. And we have not done that. Instead, we have had systems that have made it harder for people to be able to do that. And in a big sense, we need to listen and we need to figure it out. So that would be my opening.
Great. Thanks, Amber. Director Basta, I'll turn to you. Obviously, home and community-based services are near and dear to the department, but just wanted to give you an opportunity to comment.
Good morning, and thanks again for this very important conversation. You know, we do know, and everybody has said it, people want to stay and remain in their own homes for as long as possible. The Illinois Department on Aging, our mission is to serve and advocate for all of our older Illinoisans. We want to make sure we're supporting our caregivers. We want to make sure that we're giving quality and culturally appropriate programs. We want to promote partnerships. We want to encourage independence, dignity, and the quality of life. Now, to do this, we need partners, right? It has to happen that all across the board, in fact, people that are on this panel are continuing to be our partners. And we need each other in order to have all of these array of services happen. There is no more important conversation to be had, especially because of what we have just gone through these past 20, 21 months with COVID. And I think that what we do know is that we need to shore up our home and community-based services. We know that we want to make sure that it's cost effective, but we do know that older adults especially want to stay in their own homes. I think that we know people want to age in place. We know the population is aging. That's a good thing. That's not a bad thing. We want to make sure that people, as they age, have a variety of services available to them so that they can and continue to enjoy the quality of their lives. Of course, the Illinois Department on Aging oversees the largest program, which is our CCP community care program. We have over 100,000 older adults and persons with disabilities. We have those in that program. I've got my other colleague with me today. She's on the phone, Laura McCurdy, who will be able to talk a little bit more too in depth about what we are doing to shore up these services. I'm glad to see Marla Franzek, who's here representing our area agencies on aging, our AAAs, because they are important partners throughout the state of Illinois who are making sure that there are services to older adults that are living in communities throughout the state. There are over 500,000 people that take advantage of the AAAs, the area agencies on aging, in a variety of ways, congregate settings, senior centers, all of the ways in which people can go through evidence-based programs. But again, before I be quiet, to highlight the caregiver piece is key. So I'm hoping we have better conversations around that, and that we can also talk about some of the things and the ways that IDOA is shoring up caregivers. Thanks, David.
Great. Thanks, Director. Really appreciate you taking some time to be with us this morning as well. Senator Villalon, I'd like to turn to you. Obviously, you've worked in this space in this role, but also in your previous role. So just like your comments on home and community-based services and why it's so critical.
Well, good morning. And first and foremost, thank you, David. Thank you to AARP, SEIU Healthcare, Access Living, Alzheimer's, everyone that worked together to put this event together. It's good to see Director Basta. Thank you for all the work that you're doing across the state, and especially during this time. You know, really, for me, it boils down to three specific points. One is we know the data and we know the anecdotal evidence on the difference in quality of care as it relates to being CCP, HSP, being at home, being in your own environment. Two, we know that there is an incredibly large cost savings to the state, in terms of the difference between home-based care, community-based care, and institutionalized care. And three, and the most important point, in my opinion, is that this is about dignity and respect for the people that need the care. And that's really what it boils down to. My mother she doesn't want to admit it, but she is aging. And, like everyone I know, we want the best for our parents, for our elderly. And so if the best is what we want, the best is what we should invest in and make sure that we are prioritizing.
Appreciate that, Senator. Marla, I'll turn to you with just an overall question about the importance of home and community-based services for, in the populations that you serve.
Yeah, thank you, David, and thank you, Director Basso, too, for highlighting the work that area agencies are doing. You know, we recognize that there's some gaping holes in our long-term care infrastructure that is really forcing people into institutions. You just heard the story earlier of someone that ended up in a nursing home when they much rather be in the home and community. It's where people want to age. So these home and community-based services really are so crucial. Home delivered meals, caregiver support, transportation, health promotion programs. Not only do people want them and are demanding them, but they're also so cost effective. They're like a third of the cost of what institutional care is for them. And so we do, as the senator said, we need to invest in this system so that our consumers who are demanding that accessible and consumer focused supportive services, regardless of their income and assets, can get them in every community so that they can stay where they want to be in their home. So we're looking forward to seeing how we can disrupt that system with you.
No, appreciate that, and appreciate your partnership as well. This is an important conversation that's going to involve so many groups across our state and impact so many people for the better, which we're really excited about. Carol, I'll just turn to you for your comments, and I know we've covered a lot with the other presenters, but I just wanted to hear your thoughts on this initial question.
I absolutely agree, and I want to build upon all of the points that have already been brought forward and tie that together a little more with what really leads people, what are the triggering events that lead people most often into nursing homes. There is a model for healthcare systems to become age-friendly, and that model focuses on what's called the 4 M's, and that includes medication, often a triggering factor going into for a person to end up in a nursing home, mentation, mobility, which would include falls. But the most important part of teaching the health system and our community-based system to focus on these 4 M's is what matters, the fourth, what matters. Do we pay attention to things relative to our health if the connection is not made to what's most important to us? We probably don't. None of us do. And with older adults, one of the very first questions we ask them when we're bringing them into the home and community-based system is what's most important to them. 95% or more, it's I want to remain in my own home. That's what matters. So we have to also make the connection and have the assistance available on the home and community-based side that understands chronic diseases, that understands medication, mentation, mobility, and can help be proactive instead of reactive when problems begin to occur. I'm not talking about needing nurses. I'm not talking about needing medical staff. I'm talking about raising the level of our in-home care workers and the aging network system to work with individuals in recognizing medical changes or these 4 M changes that are going to impact on them, land them very often in the emergency room and then into the nursing home, or into the hospital and then into the nursing home. Thank you.
I appreciate those comments, Carol. I believe we have Laura McCurdy, a Deputy Director at Department on Aging, on the phone. Laura, I'm hearing you. Do you want to give any additional comments on the importance of home and community-based services?
Sure. Thanks, David, and thanks to all of the comments that were made earlier. 2 points that I would make, and I think Amber Smock touched on this. It's much easier to deflect older adults from institutional nursing facility care as opposed to transitioning them back once they're in and have been receiving care in a nursing facility. So as part of that deflection effort, we're very excited at the department that we're going to be able to invest funding from the American Rescue Plan into our home and community-based services, and that will be through our AAAs. We have received approximately $50 million from federal AARP funding, and we've been working closely with Marla and all of our AAA directors to enhance services, including caregiver supports, home delivered meals, a whole array of services. So we're very excited about that. And then we also have approximately $100 million through the enhanced SMAP funding, which that funding is going to go to strengthen our home and community-based services, our CCP program, which Director Basta mentioned. So we are planning to add assistive technology, home modifications. We're also planning to strengthen our adult day program that serves people with dementia and Alzheimer's. We have funding to hopefully shore up and support our workforce, which we know has been hit so hard during the COVID pandemic. So we've got funding for our CCUs as well as our in-home and adult day providers. So we're hopeful. We've not been able to really invest in our CCP program as far as adding services to our waiver for a number of years. So we're very excited at the department. Thanks, David.
No, thanks, Laura. I think that really dovetails into our next question. And you just wanted to set up this question with some research. We know that our nation and our state are facing an unprecedented demographic transition, with those aged 65 or older increasing threefold from 4.1% to 12.9% of the population. In addition, one of the things that I personally work on every day, we know the number of people impacted by Alzheimer's continues to grow and is slated to increase 13% here in Illinois by 2025. And moreover, 1 in 4 adults in Illinois has a disability of some kind. That amounts to 2.7 million people. So, Laura, I think you touched on it some about what the state is doing now in terms of expanding some of the availability of services. But are there other innovative approaches the state can take to support our seniors and to support people with disabilities in the next couple of years, in the next 3-4 years? So I'll turn. I don't know if Laura or Director Bassa, you wanted to comment on that a little bit further.
Sure. Laura, to jump in, please. And Marla and Carol, I want to give a shout out to Carol Aronson at Shawnee Alliance, who's doing amazing work and is one of our best care coordination units down in the Shawnee Alliance in Southern Illinois. I want to make sure that you see that all of us that are on this call today know that the population, as it increases now, we're at 2.8 million in the state of Illinois, and by 2030, it's going to probably be over 3.6 million people. We have a lot of work ahead of us to do, right? It's just going to be amazing that 1/4 of the state's population is going to be older adults. So we have a 3-year state plan that we have given to our federal partners, our Administration on Community Living, which is a very robust plan. We have a strategic plan. It's on our website. Please go on, see what we're planning. We can talk about that a little maybe at an AARP summit again to delve into all the particulars of the state plan. But we have to look at how diverse the aging population has become as it is now and as it will grow. And that means such things as physical, emotional disabilities, language barriers, cultural, LGBT, the geographic isolation that we have to look at too. Who's growing older throughout the state of Illinois? Most times now it's in rural communities. What does that look like as you grow older in rural communities? But we do know that people, as they want to stay in their own homes, will want a person-centered plan of care. And so when we look at how we're going to look at programming, we have to have that with that lens on. And I think that we have to do it across the board in everything that we do. So that means how we look at caregiving programs, how we look at senior center programs, how we look at our care coordination units when they go and do an assessment. How is that affecting the assessments that we do? Social determinants of health are also key. And we have to have, as far as looking at not just when you see an older adult, you don't just go into their apartment or their home and look at just one little aspect of that. You have to look at the surroundings. Where do they live? How are they living? Do they have enough food in the refrigerator? Is there heat in the apartment or the home? Is there light? Are the lights on? All of the things that are social determinants of health are all encompassing, and we will continue and even strengthen how the lens of what we do with our services and how we deliver these services will only get better, but they have to grow and expand. And so, as I think Laura gave a kind of a snapshot of what we're going to be doing with some of the federal dollars coming in. So I think that gives you an idea. I don't know if Carol and Marla want to jump in, or Laura on the phone, but feel free.
Yeah, I'll turn to Carol and Marla. Are there things on the ground? You're obviously working with these populations. Are there things on the ground that you're seeing, areas for improvement that you're excited about or hope to see in the next few years?
You want to go ahead, Carol, and then I'll go? Or
Go ahead.
okay. I just wanted to highlight one of the innovative approaches that area agencies on aging have recently implemented, and I think Director Basta touched on this in her opening remarks, was directed towards family caregivers. And so we're offering T-Care, which is an evidence-based tailored care assessment tool. And what it does is identifies family caregivers at the highest risk of burnout so they can continue to care for their loved ones in their home. These unpaid caregivers are family, their friends, who help older adults and persons with disabilities and persons with Alzheimer's disease and related dementias stay in their homes longer. So that ability to care for a loved one at home is really proven to delay that nursing home cost, which is what we are talking about, and placement, but it also saves those Medicaid dollars that often are spent on community care programs and other waiver programs. So while federal dollars have been available for those caregivers programs to support them, we really need additional dollars invested in this through the state. Illinois Family Caregiver Act was passed in 2004, never funded. So AAAs are seeking state support with House Bill 293, Senate Bill 1766 that would provide an additional $6 million for funding so these family caregivers who have taken on that role unpaid to continue to care for their loved ones. And we know it's going to save the state money, but it also helps support these people where they want to be. And Senator Villalon, we would love to have your sponsorship on this as well, because we know that these programs are near and dear to your heart too, but we really think this is going to be a great innovative approach for Illinois. And it's also going to give us real data on what the needs of caregivers are, and so we could better support them.
No, thanks, Marla. I appreciate bringing up that, something very specific and tangible that I know that you're working on. And of course, we're looking forward to collaborating with you in the coming legislative session as well. Carol, I don't know if there was anything you wanted to add in terms of specific opportunities in the next few years.
I do have something. I'm going to actually reflect on the term disrupt, which is a bold statement, disrupt. And I'm going to say a couple of things that might be bold statements. And one is that if we are serious about being able to keep a larger percentage of the older adult population in their home, even if we want to be able to maintain the same percentage of older adults in their home, but we certainly want to increase it, we have to address the maximum service costs available to do so. This also feeds into supporting caregivers, because for those caregivers who are working families, they have to work outside of the home during the day in order to be able to live in the community and keep their family member in the community. We cannot provide enough care through the community care program for those most in need to fill that 8-hour workday for those family caregivers. So if we want to support family givers, yes, we pull together both the CCP program, what we can do, and the federal family caregiver funds. We still cannot support an 8 to 9 hour workday for those persons to go to work and then provide the majority of the care to the persons that they are caregivers for. So I don't know if that's being addressed. There is also a differential between what you can get in the home care program if you're disabled and 60 and under 60, and what you can receive in the community care program when you're 60 and older. There is, those are not, there is no parity. And I think those are things, if we're serious about, and they will have costs, but they will also result in long-term savings.
I think that is one of the things that, Carol, that we're really excited about, as a part of this coalition, and thinking about some of these new and innovative ideas, and to really create better outcomes for people. I think I heard Laura. Were there some additional comments you wanted to make?
Yeah, thanks, David, and thanks, Carol, for bringing that issue up. Just to let everyone know that the department did include in our SMAP plan, it's called an intensive home services type of model that hasn't yet been totally fleshed out, but that will be in year 3, and we included $10.6 million in funding for that, and I think we really need more discussion and stakeholder feedback, but I wanted you to know that the department recognizes that we do have older adults and adults with disabilities that do need that more intensive level of support. So I just wanted to make sure that you all were aware that we did include some funding, and we plan to look at that, what that service will look like, and how we can get stakeholders' feedback on that. But we're very aware that we do have folks that do need a higher level of support, as Carol just talked about, the service cost maximums not being sufficient. So thanks.
Thank you, Laura. Amber, I wanted to turn to you to talk a little bit about the disability community and some areas of opportunity you see.
Okay. Yeah, this is Amber. I wanted to say, first of all, thanks to everyone for bringing up the issue of the need for increasing the service cost maximum in the CCP, because for sure on the ground at Access Living, we have seen that folks that we would like to transition out of nursing homes who are over the age of 60 but require personal care support, such as bowel programs, bathing, et cetera, we can't move them, because we can't move those people because we don't have the actual program to support them. So we need to be able to remove that barrier in order to move those folks out. Some other things that I just wanted to bring up as near-term opportunities for innovation and change are, first of all, I do want to point out that I serve on the State Medicaid Advisory Committee, and we have recently established a new subcommittee on community integration, and that meets every other month. And so that is creating a space to be able to talk about what else, who else, where do we go, and so that way the work will have a space for continuing on past the next 3 years. So while the on-the-ground work is happening now, we need to be talking about what else. I also want to point out that the Illinois Department of Public Health has a center on minority health services. And I would hope that we could work with public health and those that are focusing on racial disparities to look at where do we need to improve social determinants of health. So that's important. Another thought, by the way, is that, many of the people who provide unpaid caregiving are folks who are immigrants who may not have status. And many of the people who provide caregiving are also people who might have criminal backgrounds. And removing barriers for those persons to be able to be compensated adequately and manage it within what was being talked about before, the fact that maybe you're working full time and then you're coming home or weaving in your caregiving. How do we make life more livable for those folks, especially because many of those people have great experience in providing care, but there are systemic barriers that are in place that prevent those folks from being compensated or being recognized as doing the work that they actually do. I also would like to just share that, the Centers for Medicare and Medicaid Services, CMS, produced a toolkit on rebalancing, and I believe that's part of the materials in your handout. And the CMS's toolkit points out that there are 7 specific items that states can really focus on in order to shift, home and community-based services. And I just want to note what those 7 things are for everybody, because I think to some extent a lot of that work is being done. And then the question is, what is not? Right? So those 7 areas are, first of all, person-centered planning and services. So folks are working on that. Second is no wrong door system. So allowing people to be able to access what they need, without being shunted from one thing to another. Third is community transition support. So clearly getting people out of congregate settings. Fourth is investing in direct service workforce and caregivers. 5 is housing to support community-based living options. 6 is employment support. There are a lot of folks who are at risk of institutionalization or could be at risk of institutionalization who can and want to work, but they can't. So employment support is key. And the 7th one is actually a convenient and accessible transportation option. Because we do not have good transportation, and I mean all across the state, right? We see people with disabilities and seniors who don't have a lot of support experiencing hell, trying to go places, and actually being forced to spend a huge unconscionable amount of time waiting for rides and dealing with systems that they may or may not have the ability to advocate for themselves with. So all of those things are things that we need to be working on, and we are to a degree, but I think there's a lot of room to bump it up. And one last point I'd like to make. We can do this, and the reason I know we can do this is because if you look at the federal reporting on Medicaid expenditures for home and community-based services versus nursing facilities, we know that from 2012 to 2016, at a point where the state was busy investing quite a lot of money and effort into expanding home and community-based services, Illinois was one of the top 10 states expanding home and community-based services. We jumped 8% in our shifting of money that went to Medicaid, long-term services and supports for home and community. So for sure, when we have a plan and we're putting the effort in, we can do this. So that is something important that I'd like everybody to take away today.
Thanks, Amber. I think these are really exciting opportunities. Like you say, we can do this. That's a really important thing that I think. One of the things, as we designed this panel, and as we talked about this, one of the things I wanted to focus on here is that, of course, there are a lot of challenges in what we do, and there's a lot of challenges that we currently face. But it's also so many opportunities, and when I'm so excited to work with all of you, and of course all of us, those watching today, to work on these issues and to build that coalition to move forward. I know I'm just cognizant of the time, and I think we've had some really good discussion, but I do want to move through some of these questions, and I'm not going to maybe get to each panelist for each question. So Senator, I know we didn't get to you for this last question, so I'd like to start with you for the next question. Regarding the workforce in HCBS, as we know, employment, getting people to work is just a huge issue for home and community-based service providers across our state. And so that hits hard for people with disabilities, for seniors who rely on these services. How do we encourage, how do we retain, how do we grow our workforce in home and community-based services? And Senator, I'll start with you for your thoughts.
Thank you, David. And I'll just say, as a brief comment on the last question, I'm there on all of the ideas. I think they were incredibly appropriate, and I look forward to working with you all on them. And duly noted in terms of my marching orders as I move forward into this session. And I'll also add, though, that it is also important for us to look at the legislation that is now law that we did work on over the last couple of years and make sure that it's being implemented in the way that we intended. All the legislation that we worked on and we can go into detail, but it is incredibly important to make sure we follow up on that. As far as our workforce, this is, as David alluded to, I used to work at SEIU Healthcare, in case anyone didn't know, and I was very rooted in that work. And we talked to workers every single day about the struggles that they had. And a lot of people, what I find is that a lot of people don't understand some of what we're talking about, right? Like, for example, it was mentioned earlier about the schedule and the hours, right? And so I think when I explained to then not my colleagues and now my colleagues, is that there are certain times, right, that caregivers are needed specifically, right? It's not like they can just clock in at 9 and leave at 5. And so when they hear, oh, the caregiver only works 20, 25 hours a week for this particular person and so forth, they think, oh, well, why can't that person just get another job for 20, 25 hours? Well, when you are going over at 7 a.m. to 10 a.m. to help with the morning activities, including breakfast and whatever else that needs to happen, and then go over for lunch and doctor's appointments that occur from time to time. That schedule is not conducive to having another job that allows them to make ends meet. And so it was a real educational point with my colleagues as to, hey, this is the type of schedule that they have in order to make sure that who we're fighting for, the person that we're fighting for, gets the care that they need. And as a result of that, the caregiver, unfortunately, is in a situation where it's really hard for them, to provide for their family, provide financially, and so much more. And so, first and foremost, we owe it to them. We owe it to our caregivers, not just because of the last couple of years, but because of the last couple of decades, quite honestly, of the work that they've done. And yes, the point was made, Senate Bill 1766, whether you're your family or you're not, care is care, and you're providing that care, you're making that sacrifice. So yes, you should be paid, period, stop. And so I strongly believe in that. We need to make sure it's a living wage. This was also touched on. We need to make sure that they have affordable and accessible transportation. One statistic, as chair of transportation, I was going to mention it, but it was already mentioned. One statistic, when we talk about inequities in the Chicago area region, 95 out of the top 100 longest commutes stem from Black and Latino communities. So what does that mean? That means it's harder for them to get to their job, which is what we're talking about, harder for them to get to their hospital, their school, and so much more. And obviously, we know the challenges with transit in rural areas as well. And so I would say, first and foremost, correct the unpaid piece. Secondly, make sure everyone gets a living wage, make sure people understand the scheduling part of it. And then thirdly, making sure that we're doing the other things that we need to do in terms of transportation, in terms of benefits, in terms of working conditions for those caregivers that make them want to stay. And I say that because we often said my former job is some of them that when they leave, the reason is simply they can't afford to stay because they have to go pursue another job that will provide more hours and more stability. And that's really unfortunate because I got to tell you, my mom is more religious than I am, but I'll say this: caregiving is God's work. It really is. You become that caregiver becomes a part of your family, and they truly go above and beyond. I can't tell you the number of stories I've heard go above and beyond for that person that they're caring for.
Absolutely. Thank you, Senator. I think that's a view that's here. I see a lot of nodding heads when you're talking about that here on this panel. I'm going to turn Director Basta. I don't know if you wanted to comment on some of those workforce challenges from the department's perspective.
Well, we all know them, everyone on the panel, those that are watching today and those beyond. So we know it. I think one of the things we want to make sure we were able to do at IDOA was early on in the pandemic, March of 2020, we were one of the first agencies to get PPE out the door to all those in-home workers. They were at times the only workers going out to do their God's work, as the senator just said, and we wanted to make sure we tried to keep them as safe as possible. So again, this is a workforce that needs to be supported and highlighted, but also to be made sure that they know and take seriously to make sure that they're going to be safe while they do their work. The other end things I want to make sure that people know is we're working on getting the rate increases for in-home services and our adult day service providers started, and we have already done those rate increases, and we'll continue those rate increases starting again January 1st of 2022. It will boost worker salaries, which we know has long been needed. Additionally, our FMAP proposals that I think Laura alluded to includes funding for bonus payments that we're going to be giving out to our care coordination units, our CCUs, so that the CCUs have rate increases that are based on an earlier rate study that we did. So again, getting more money to the most direct services that are happening with our boots on the ground to those who are doing the actual work. IDOA also has an older adult services advisory committee. We are working on long-term pipeline strategies with our OASAC committee. We want to make sure that we have a more robust workforce. What does that look like? It's going to be about education and how we want to get people in the pipeline of wanting to learn about geriatric education early on. Let's even say high school. I apologize. My other phone is probably my mother. Anyway, but my 90-year-old mom, she loves my landline. Anyway, I just want to make sure people know that we're looking to how we do education because we want to get people that are young to think about working with older adults and get into thinking about gerontology as a viable profession. And so we're looking to do things like boost up in community colleges, high schools, the American Gerontological Society Academy Geriatrics of Higher Education, working with our ISB, the Illinois State Board of Education. We want to make sure that we can talk to them about including geriatrics, gerontology, older adults, healthcare, those kinds of professions should, as we have seen, especially during the pandemic, have been the heroines of on the front lines. We want to make sure people know that it's something that should be excited about entering, if in fact you have that calling. And how can we make it easier and more accessible? How can we make it affordable so that you can live a good quality of life on a salary for that job? So I think it's all of those strategies rolled into one, but absolutely, I think education is a big piece of it.
No, thank you, Director. And I know, this is such an issue and a challenge that we're going to continue to face. But I know that if we work together and with you, all of you who are here at home or at your offices or wherever you're at watching and participating in this, we need your voices as well to help make sure that we're able to make that change. So I do want to move on a question to, we've had a number of discussions and the senator brought up the importance of caregivers, especially family caregivers and unpaid family caregivers. And how do we recognize and engage those caregivers as key partners in home and community-based services in providing that long-term care? The value of that care is in the billions and billions of dollars right here in Illinois. So what more do we do? And I know, Marla, you talked a little bit about a specific initiative that you and some of the other AAAs are working on. But I don't know, Marla, if there was something else you wanted to add and reemphasize on how do we recognize and how do we better support family caregivers?
Yeah. Thank you, David. I really do. I totally agree. And I think we all do here. The real challenge is that these family and friends, they don't recognize that they actually are doing this work for people. They're doing it, out of the goodness of their heart. They're doing it to care for their loved ones. And often they jeopardize their financial security and their own health in doing this work. So AAAs, what we're going to be doing in the upcoming year is we're going to be building a broad stakeholder coalition to bring awareness to this issue and promote the need for changing policies that go to supporting these family and other unpaid caregivers out there, so that we can identify again those gaping holes in our long-term care infrastructure that is really forcing older adults out of their homes and into institutions when they'd rather be living in their own home. And it's putting that tremendous strain on those families to provide that uncompensated care. And so we're really looking forward to engaging all the work that you're doing here, but also businesses and chambers of commerce and everybody to recognize the impact that unpaid caregivers have on our workforce. And so if we can all come together and invest and find ways to strengthen and support those unpaid caregivers. So we're looking forward to some social media campaigns and a really robust effort here in Illinois to strengthen those efforts.
Great. Thanks, Marla. And Amber, I'll turn it over to you.
This is Amber. I just wanted to make a couple of points on the caregiver end. One is that because the state of Illinois has had to operate in a financial scarcity situation for so many years, one thing that seems to be given short shrift is financing marketing. And so making sure that there are funds for outreach, funds for getting the word out. And because of the scarcity situation that we've had to deal with, there tends to be an assumption that, frontline staff will spread the word. We'll do some presentations with people and, it's going to happen. But we can't, and getting the word out, you cannot assume that people are going to hear about what you want them to hear about. And so making sure there's actual financial investment in marketing could be a game changer, I think. The other big thing that I think would be helpful there's a few things, but I mentioned before trying to make sure that there are opportunities for folks with backgrounds to be able to be caregivers. And I know this is a bit of a controversial subject. However, here in Cook County, we actually have a new ordinance called the Just Housing Ordinance, and it's related to making sure that there's not discrimination by landlords against potential tenants who have backgrounds. And they've established an actual process for how that's supposed to happen. And I would just suggest take another look at how they do that, because perhaps that might give people flexibility in situations where that's a very reasonable thing to be able to do. So the last thing I just want to point out is that Access Living has long said that one of the things that keeps folks in the community is home modifications. Caregivers need to know what home modifications are and to be able to have access to funds and support to make home mods happen. And I'm talking about, ground bars and bathrooms and widening doorways and that sort of thing. But people also need to be able to have that. We need to be sure they can get out of their home to the sidewalk or to the car. And so a lot of home mods programs are for inside the home only. And that's a big problem. So home modifications can be a major support for caregivers, and that's critical. And actually, Representative West from Rockford is leading an effort on investing in home modifications, expanding that fund across the state. And so for people looking at legislative work and everything, I would definitely suggest talk to Representative West, because we're very excited about increasing access to home mods with fewer bureaucratic barriers that currently exist for home modifications. Thank you.
Thank you, Amber. I think this is, obviously it's really important work. And I think one of the things I just wanted to play out of what Amber said is that, highlighting the work, there's obviously a lot of work going on with senators and representatives from a policy end from across the state. And I think just like the diversity of this panel, representing the entire state from Chicago to suburban to rural, I think all parts of the state, this is a really critical issue. I guess I'm going to really quickly get to a kind of a final question before we wrap up. And we know there are pain points for family caregivers, for paid caregivers and recipients of services, such as access in rural areas, workforce issues, cultural awareness issues. And so I just wanted to see if any comments on how we can continue to address and overcome these challenges. And Carol, I'll start with you, obviously working in an area in downstate Illinois.
Although in rural areas we don't have the same numbers of older adults and persons living in our areas, we do have a higher percentage that are older. And that creates quite a challenge when the younger population has left the area for work and a large percentage of what you have are older adults. One of the major concerns I have right now is seeing the impact financially on older adults and on families that they are experiencing now and will experience to a greater degree. And I think we have to turn some attention to the fact that the poverty level is not a measure of poverty. It does not measure what it actually costs to live in communities these days, and especially not what it costs for older adults to live in communities. So I think that we have to take an approach of also, you could look at it through the social determinants of health, but basically it's just the economics of being able to live in the community. And there was a time when very often those persons who resided in nursing homes were very low income, challenged individuals, and that is still the case. And we have to take great strides to make sure that does not continue to happen. So the Elder Economic Security Initiative that was researched and is out there in the past, I think there's a lot of need to take a look at what has to occur when looking at it community by community, whether it's a rural county or a suburban county. What does it really cost to live there? And with the rising costs of food and other items that's occurring right now, I really have great concerns. We've always seen older adults having to move to long-term care because of lack of financial resources to remain in the community. And I really fear we're going to see that increasing greatly over the next year.
Absolutely. Well, I know we're very quickly reaching the end of our first panel, and I know with this group we could talk for hours. And I know we had prepared questions. I know there's been some questions in the chat, but I really just wanted, before we close, to offer each panelist do kind of a lightning round of just 30 seconds to a minute. Any final thoughts on the issue of home and community-based services that you want to leave our viewers with today? And I'm going to start with Deputy Director McCurdy on the phone.
Sure. I think, one of the things we hear frequently is that people just don't know about the community care program. And so I'm really interested in how we can collaborate to get the word out and to improve outreach to older adults. I think we all agree that people want to age in place. They don't want to, live their last years in a nursing facility. But for some reason, we have a lot of people that don't even know that CCP exists. So I'm interested in what Amber, I think, talked about a little bit, which is the no wrong door concept. The no wrong door was part of the balancing incentive program, which Illinois was a part of back about 6 or 7 years ago. So if we could maybe look to that and see how state agencies can collaborate to move forward with the no wrong door. So people aren't told to call, if they call doors or they call, another agency, then they're told to call aging. I just think we need to make everything more user friendly for our older adults. Thanks.
Absolutely. Amber, any final, very brief final comments?
Oh, this is Amber. Sorry, sometimes I have to catch up with the captioning. I am a person with disability handicap, so props to the AARP for making sure we have captioning. Yeah, my final thoughts are divert, deflect, transition, support. We can do this. We can. And that is what I have to say. And it's a massive effort. We can take advantage of the funds that are forthcoming from the federal level, but I just want to let people make sure that people remember we can do this. So that would be my final thought.
Thank you, Amber. I love that. Marla, final brief thoughts.
What Laura McCurdy and really Amber said too. I think the awareness is really key out there. Area agencies on aging offer a robust system of home and community-based services. They're for anybody regardless of income or assets, and a lot of these wrap around the community care program. And just putting those programs in place for people really are vital to keeping them in the community. They just need to know where to go and how to find out those. And so just directing them to what's available in their communities. And a lot of things go beyond just what the state and federal government funds. Our local communities are really supporting older adults and persons with disabilities with a variety of programs. And we just want to make sure they all get connected to them so that they can age well.
Thank you, Marla. Carol, brief thoughts.
I think the no wrong door, single point of entry are all extremely important, especially for older adults and disabled. A complex, confusing system where they're being sent multiple places, they give up. They literally give up, and so do their families. But everything also hinges primarily on having the workforce to do this work. And if we do not adequately reimburse and pay and recognize the workforce in order to attract and retain the workforce, we can't do any of the work.
Absolutely. Director Basta, final closing remarks.
Thanks. Partnerships. It is exactly what will help us get this work done. We are continuing to get it done every single day. We did before the pandemic. We did it during the pandemic. We're doing it as we live through the pandemic now, still 2 years into it. We will get through this and go on from after we live through the pandemic. It's going to be partnerships. It's going to take all of us. Everyone, the esteemed panel you all have put together today is a prime example. It takes legislators. It takes advocates. It takes the professional case managers, care coordination units, area agencies on aging, the Aging Network. It takes Alzheimer Association. It takes AARP. AARP Illinois, shout out. Love you guys. We continue to need to partner together because government cannot do it on our own. We need all of each other. We need all of us together to do it. We definitely are energized by seeing all of you as our partners. I can tell you that. And it's an honor to be with you all today. Thank you.
Thank you, Director. Senator, I'll give you the last word for some brief remarks.
Thank you. Thank you so much, David, and to all the organizations that have put this together and for inviting me. And it's so great to see so many familiar faces, and hopefully we can see each other in person. I don't know about you. I'm getting a little tired of Zoom, just a little. But most importantly, I just want to build off of what has just been said. We need everyone that's on this Zoom or WebEx, or I don't know what this is exactly, but we need everybody because we clearly have the ideas. Every single idea you heard today is a great idea. We clearly have the financial argument. We clearly have the moral argument of why we need to do this. And all that's left is the political will. It is getting 30 senators, 60 representatives, and the governor to agree that we need to do these things. And I'm proud of the work that we've done as a legislature. I'm proud of the work the governor has done. However, I always tell people there's always more. There's always more we can be doing to make sure the people that we care about deeply are getting the care that they need. And so I would just say, everyone that's watching, please get involved through the organization that you're affiliated with. Please reach out to your state representative, your state senator, ask them to sponsor legislation, ask them to co-sponsor. That's how this is going to get done. We have the ideas, we have the financial argument, we have the moral argument. the last remaining piece is just the political will to do it, and that's where you all come in, because ultimately we work for you. So thank you.
Thank you, Senator. And thanks to each of our panelists this morning. This has been an amazing discussion, really exciting, and I think optimistic discussion of the really good work that's been done, that's being done, and the opportunities in the future. And I think that phrase, I think Amber said it best, we can do this. That's what I want to leave you with. So we're going to conclude this panel at this point. But do stay tuned. We're continuing our live Disrupt Long-Term Care Summit with the second session, Breaking Down Barriers to Quality Care in Illinois Nursing Homes. Thank you all for joining us for our first session. There's going to be a brief intermission. Stay live right here on your current virtual link, and we'll have a brief video and then move into our second session. Again, thank you, and this concludes our first session. Stay with us.
Ramirez, President and CEO of Chicago Commons. Chicago Commons is one of the oldest leading social institutions and agencies in the Chicagoland area. We help and support individuals to overcome poverty and systemic barriers and embrace opportunities to thrive across generations. That includes our senior population. And why is it important now that Chicago Commons aid and support the idea of disrupting the long-term care options that seniors currently have? At Chicago Commons, we primarily serve Black and Brown low-income seniors across Chicagoland area. It's important for Chicago Commons to disrupt long-term care because older adults of color experience a significantly higher rates of chronic diseases than their white counterparts. As you imagine, the impact of the pandemic has likely exacerbated these conditions. The time to disrupt long-term care options is now, and we cannot wait for tomorrow. Seniors deserve to age in place. Seniors deserve to stay in their homes, stay in their communities, where they are supported, where they help in many ways frame out those communities and establish those communities. It's important for seniors' social, psychological, and emotional support and well-being to be able to stay in their homes. And it's important for the state that they live in and have supported for many years to support that option, right? It's the way, it's the right thing to do for the state, for lawmakers, for community-based organizations, and for all Illinois citizens to support that idea that a senior has the option to age in place.
Kelly Richards, and I am the Long-Term Care Ombudsman. The Long-Term Care Ombudsman program advocates for residents who live in long-term care facilities. We also have the Home Care Ombudsman program that advocates for individuals enrolled in the Medicare and Medicaid Alignment Initiative, or home and community-based waivers when the rights of those individuals have been violated. The Ombudsman program makes routine visits to long-term care facilities and provides information and assistance, and work to resolve complaints made on or behalf of residents in long-term care facilities. I think we're at a moment of time where a spotlight has been shown on the plight of residents in many of our long-term care facilities, and we need to seize this opportunity to push for change to improve the quality of care and quality of life for each and every adult that's living in a long-term care facility in Illinois.
I've had very limited contact with my mother for a year now. It's been super hard not being able to be with her. To get this back it's beyond words.
Hi.
To get to be physically with her, I tear up.
Baby girl.
I give you a real hug.
The normal thing is to be able to hug, hold hands. And for a long time, we didn't get to see each other at all.
I have friends who lost a parent and didn't get to see her because of COVID, didn't get to be with her. And I did worry about that. You know, I'm lucky that my mom's still here. And to get to hug her, better than ice cream, better than pizza, better than chocolate.
That's good.
I'm so grateful I get to see her. I know what a blessing that is, but it feels like I was robbed for a year of time with her. And I'm not going to get that back, but I'm super glad to have what I've got. I feel like a piece of myself has been given back.
You're in here. That's where you are.
I know.
Hello and welcome. My name is Josh Harris, Associate State Director for AARP Illinois. I want to welcome you to this important live virtual Disrupt Long-Term Care Summit. You are joining us for Session 2, Breaking Down Inequities and Barriers to Quality Care in Illinois Nursing Homes. Today's virtual Disrupt Long-Term Care Summit would not be possible without collaboration with coalition members, Service Employees International Union, Access Living, and Alzheimer's Association of Illinois Chapter, and AARP Illinois. If you would like to ask a question anytime during this live summit session, please post your question or comment in the chat box, and we will be addressing all comments and questions throughout the session. Today, we are live with esteemed leaders in state government and the leading home and community-based services and nursing home labor organization in Illinois. I am honored to welcome you to today's panel, including State Representative Camille Lilly, State Representative Anna Moeller, SEIU President Greg Kelly, and Associate State Director with AARP Illinois, Lori Hendren. To read more of our incredible panelists, please click the bios link to read their respective bios. And throughout this session, please reference the handouts feature to download key resources the Coalition has made available to you, the viewer. The Illinois Disrupt Long-Term Care Coalition is advocating to rebalance the state's long-term care system. The state of Illinois must provide adequate long-term care services across the spectrum of care, with appropriate services which are accessible to any resident dependent on their level of need. Illinois' most vulnerable residents who live in nursing homes deserve better than subpar conditions. And sadly, our state comes in last in nursing staff levels, and it dominates the list of states with the lowest performing nursing homes. In fact, some of the slides that you just saw during the intermission, the Department of Healthcare and Family Services report uncovered staggering and grave findings. At least 40% more Black and Brown Medicaid residents in nursing home facilities perished than would be expected based on COVID-19 mortality rates among white nursing home facility residents. They saw that Black and Brown residents are nearly twice as likely to reside in an understaffed facility. On 3 occasions in recent years, the Illinois General Assembly increased funding to the sum of about $160 million to nursing facilities for the purpose of increasing staff. Yet in 2019, Illinois still ranked last in staffing, and many facilities remain woefully understaffed. More than half of Black and Brown residents reside in nursing facilities that are both understaffed and room crowded, and they are nearly 3 times as likely as white residents to reside in such facilities. Simply put, it's time to hold nursing homes accountable for providing safe environments and high quality care for residents. I'd like to welcome our esteemed guests here and bring them in for this important discussion. Thank you all for joining us today. Let's start with the first question here. Significant opacity exists within the transparency and accountability of nursing home funding streams, including within public funds received. This opacity has prevented a clear view into how public and other resources are distributed in resident care. Can you all discuss policy measures to heighten transparency and accountability of taxpayer dollars so money follows the resident and their quality of care in Illinois nursing homes? And why don't we start with Representative Mueller?
For having me on this panel and as part of this very important discussion regarding long-term care in Illinois. As you alluded to, we have a crisis on our hands in Illinois when it comes to the care for the most vulnerable in our communities. As the chair of the House Human Services Committee, I've been my committee has been leading hearings along with the Human Services Appropriations Committee, the Mental Health and Addiction Committee, and Healthcare Accessibility Committees to gain an understanding of what's happening in the industry and how residents and families have been affected by the problems in our long-term care facilities, and certainly, and in particular, with Black and Brown communities and the facilities that exist in our lower income neighborhoods. One of the challenges that has been highlighted as part of these discussions is the lack of transparency in how revenues that flow from the state and federal governments into nursing home operations and facilities, how those monies are spent, and ensuring that those funds are being used on care for residents. And that's going to be one area for reform that has been proposed by the Department of Healthcare and Family Services, and something that I think as legislators, we are keenly focused on, so that we can have an understanding of how these resources are being used. We had a discussion just yesterday with the nursing home industry about reforms that are being presented and proposed by the administration, and because of the lack of transparency in how these funds are used, it creates a difficult situation where industry, refutes analysis that's been done by the administration in terms of how reforms would affect facilities, and as policymakers, it becomes challenging to get a full picture and understand exactly what's, which side is presenting the most comprehensive picture. So yes, there needs to be reform in that area. We need to understand who owns these facilities. We need to understand. We know that we have a large percentage of our homes are for profit. And because of the nature of that business arrangement, a lot of information is not available to stakeholders and policymakers, and that's a problem.
Absolutely, and I'd love to get Representative Lilly in, who's joining us by phone. Representative?
Thank you so very much, and I too appreciate being a part of this panel, and it is a critical discussion and issue for families across Illinois. We, as Representative Moeller indicated, have pulled 4 committees together to work on legislation that reforms the nursing homes and expands long-term health care services for the citizens of Illinois. We are approaching it in in a number of ways, where we're presenting the facts of why the families are needing the reforms and their concerns about their family members. We are going to address the issues that they have brought up when it stems from not the lack of care plans or understanding that there is need of care plans for their family member, to address the requirement of having a nursing team, a medical team, a staff available to the residents, which has been a question for residents themselves. We will continue to address how we can utilize the resources that we have available to us here in the state to bring quality of life to all Illinoisans. Yes, there have been disparities in our communities, the Black community and the brown community, and those issues will be our priority. Not only do they have to have access to nursing home services and long-term care options, they need access to so many other basic essentials, from housing to jobs to health care in their community, child care. All those things are missing in those communities, which is placing the Black and brown community in these nursing homes, what I'm going to say, prematurely. And that's their only option. And in their only option, they are at risk. They're put at risk. So as we look at this critical issues that's impacting all of us, it's all of us have someone who is a senior, someone who's disabled, someone who has mental health challenge. We all are impacted by having access to the appropriate care that shows compassion and concern. So we're bringing reforms that's going to change the mindset of the industry, the mindset of the agencies, and we, the legislators, are going to work with the people to make sure that their concerns are addressed. And we are looking to put that forth in the spring General Assembly and subsequent General Assembly. So I'm just happy to be here with AARP, who has joined us in this important concern for the citizens. And I'm looking forward to listening to more of the panel and to listening more of the people. Thank you.
Thank you, Representative. Greg, why don't you jump in here?
Well, good morning. Of course, thank you, AARP, for having me. It's truly an honor to be here and to hear and participate with such great legislators. I think what I would just sort of echo what Representative Moeller said regarding transparency. One of the big problems in the industry is a lack of transparency. We've been sounding the alarm on this issue for a number of years, but it really is that lack of transparency and lack of accountability that for us really creates much of the problem that we see today. Our union, we represent tens of thousands of home and community-based workers, but we also represent thousands of nursing home workers who worked throughout this pandemic and really exposed some of the real challenges in the delivery of long-term care overall. But in nursing homes in particular, our members really struggled these past nearly 2 years now. And as we've tried to continue to improve the ways in which workers are protected and paid and et cetera, we found that there are real challenges in really figuring out where the money goes and making sure that facilities are properly staffed, and that in fact the workers in these facilities are paid in a way that would encourage them to work and to stay. There are real challenges now in nursing homes, just getting people in the door, and then when you get them in the door, to keep them. A lot of it has to do with lack of pay, which we think can be addressed by more transparency and more accountability. I think the rules, I guess, have been followed, if you will, by the industry, but there seems to be a lack of clarity around what those rules actually are, but we see the impact of that lack of clarity. And so we believe that if we're going to really change the industry, that there must be more transparency and accountability. And I would just offer just an example of the type of policy changes that would help. Just one example. There currently is no law in any specific amount of nursing home revenue that has to be dedicated to resident care. We can change that. There's broad, so much, it's so broad in the ways in which they can do this that there's ways to skirt it. So we're saying there has to be more accountability, and that there must be a baseline amount of money that must be dedicated to resident care. And we think that can perhaps begin to change some of the tide on this. But I look forward to more of the conversation.
Absolutely. Thank you, Greg. And finally, Lori, from an AARP Illinois perspective, as you lead this effort for us, can you chime in here?
Yes. So first, I want to say thank you for all of the esteemed panelists here, the lawmakers who I know are absolute champions. They have had hearings throughout the fall and spring session, and President Kelly, your leadership and your team is remarkable. And I thank you for your partnership every day. So to give you perspective, 79% of nursing homes are for profit. And a lot of times these facilities are the high Medicaid for-profit facilities. 95% of them are understaffed. So we're driving in a lot of taxpayer funds with no sunshine to it. To me as a taxpayer, to me as a loved one of someone in a facility, that is concerning. One of the things we have to do, and I echo President Kelly and Representative Lilly and Mueller, is truly put sunshine on where these dollars are going. We know, if you look in your documents section, there is something, the HFS comprehensive review, and they put it together. And in there, it is simply stated that a lot of the ownerships in these facilities are short-term investments, and a number of the investors may are more passive investors. And a lot of times they hold just minority shares. And a lot of the times these profits are being given out to like trickle down to, frankly, loved ones of an owner or a relative of an owner. So you may have an owner, but then you have possibly family trees or friends and family having a stake in it. And they're all driving probably at the same understaffing and decreased quality of care. It's unacceptable. So as a state, as taxpayers, as advocates, as loved ones, as caregivers, we have to demand the same level of sunshine and accountability and transparency that other businesses have to go through when they receive funding from the state. And even more so because understaffed nursing homes, not paying frontline staff and making sure the quality of care is for resident and money follows the person gives us to where we are today. It breaks my heart to see the videos that we saw in the opening and the testimony and what people are living through. And we can make that change. And it starts with all of us together, raising the demand for change and realizing that we have powerful industries that are out there that are ensuring that movement doesn't go forward. And we can make a difference, and we can push forth legislation and unify our voices and be the foot soldiers and be the powerful voices to make a difference.
Thank you, Lori. And sort of pivoting here to the next question we have. The inequities of care of Black and Brown nursing home residents are alarming, as we've seen in the slides and as we have talked about just previously. So I have a twofold question for our esteemed guests here. One, how did Illinois get here? And two, what specific policies will erode this alarming differential in nursing home care? Why don't we start with Representative Lilly?
How do we get here? Thank you for that question. Real quickly, I'm actually in a hospital with my dad as we speak, but I did want to get on to just really just talk about my experience at some point of the panel. But how we got here is when we're caring for people's lives from a health perspective, profitability has been the priority versus the people. And healthcare should not be a profitable situation, nor nursing homes, nor loan care. Because decisions are made by those administrators, those presidents, based on profitability. And we need to look at healthcare as a right and ensure that all citizens have access to healthcare so that they can have quality of life. And our legislation should reflect our preamble in our Constitution, and it does not. So we need to get back to why we are here in the first place. We're here for the people and to provide dignity of life and dignity and respect of family. And we have gone away from that. Profit over people has to stop now. Thank you.
Couldn't agree more, and our thoughts are with you, Representative Lilly, and your father. President Kelly, how do we get here?
Again, my heart also goes out to you, Representative Lilly. It's systemic, like most things in our country. Things have existed a certain way for a long period of time. The industry is strong and has a lot of influence, and I think it took, unfortunately, COVID for folks to really feel the urgency of addressing this problem. It has been baked into the delivery of long-term care in our state for many years. And every opportunity we've, tried to implement has been met with some foot dragging, some opposition. Laws, of course, are often created for folks to try to get around. And the industry has been pretty good at that. I think we fought tooth and nail some years ago to get safe staffing legislation passed. And we've had safe staffing passed in the state a couple of different times, yet somehow we haven't seen the type of improvement that the legislation sought to see into reality. But I think COVID now has created an opportunity for us to, for once, begin to actually tackle this problem. And I think even the industry itself understands now that the current state of things can't continue, that there must be better staffing, that we can't have 3 and 4 bed ward rooms, that enforcement of staffing regulations are important, that it's not enough to just simply have those laws on the books, but they have to actually be enforced. And so I'm happy that the administration recognizes this and is really, I think, staffing up to make sure that enforcement of staffing is a big part of the solution. But again, it's long-standing problems, but I really do believe now is an opportunity to really turn the page and make sure that we have the type of nursing home and long-term care system that protects everyone, that understands that Black and brown communities, which are disproportionately impacted by the current system, get the type of equity and fairness that's going to really improve the lives of all of us in the state of Illinois, and not just those in those communities. So I'm excited that we have an opportunity to do more now. And again, it's going to be a broken record, but it starts with accountability and transparency, and we can do it.
Well said. Accountability and transparency. Lori, what are your thoughts? How do we get here?
Yes. Well, following President Kelly, I can just say ditto. But it's right there. It's been baked into the system for too long. We had lawmakers have truly fought to make change, and yet the implementation of it is hard. Even if you get a law passed, you still have regulations. But it goes back to the transparency and the accountability. And for communities, Black and Brown communities, you are many of times, you're balancing so much as a family caregiver. You may be working rotating shifts. You are caring for your loved one at home. You are maybe making minimum wage, having to pay for their prescription, looking all over the community and asking Facebook friends for a ramp to help get your loved one out for surgery. And at some point, you hit a breaking point. You can't continue to do it all. We have 1.5 million unpaid caregivers in our state. And you look to nursing home care to be able to give that loved one that 24-hour care, not because you want to, it's just you can't do it anymore. And then you realize where the care that they may be getting, or the minimum care that they can't. President Kelly talked about the ward rooms, 3 to 4 residents all in one room. And in COVID, it just shined a light on it. We had disease, the virus spread. So this has been something that I don't think a lot of people wanted to talk about, and COVID brought it out. But we have to have accountability for the nursing homes who are not hitting the bar. And I think I'm going to lean this over to Representative Muller, because she is on the cusp of moving a bill for the nursing home accountability and assessment change. And that is a huge step forward to changing the status quo.
And Representative Muller, your thought?
Okay. Yeah, thank you. Sorry. Well, I can't, there's not much more to add that's been already said. I mean, thank goodness for AARP and SEIU and the champions, outside the legislature who have been talking about this and working around this issue for so many years. Unfortunately, as has been alluded to, there has been a lack of political will in the past, I believe, to make meaningful reforms. And some of your commentators in the chat kind of hit on some of those reasons. You have people who, people in nursing homes haven't had a very loud voice, or a very, they're not able to come down to Springfield. They're not able to, write checks to campaigns. Unfortunately, I'm just to be very frank. But the industry that is bringing in billions of dollars into these facilities, they are in Springfield every day, and they do write big checks, and they've been the force behind making meaningful changes. And the one thing that gives me optimism is that we've seen a leadership change in Springfield over the past several years. We have people in place who care about this issue, who understand this issue. And as has been mentioned, the crisis that we've just lived through really revealed and made it impossible to ignore the problems that we see in our nursing homes, the chronic understaffing, the ward style rooms that we see, especially in lower income communities. I think it's a problem that has been easy to ignore, because if you're not in a facility, if you don't have family members, if you're not, working on the front lines like AARP and SEIU, you don't see these problems. But now they're out there, and that's the reason why we've been having these hearings over the past 8 months, and bringing in families and bringing in nursing home residents to really shine a light on what's going on, so that the public can see what's happening in these facilities. People need to understand that from like a visceral level, and hear these stories in order to compel change. So unfortunately, it did take a crisis for us to get to this point, but I am optimistic that greater understanding and a change in leadership in Springfield will lead to some very meaningful reforms.
Thank you, Representative, and thank you all for that very important discussion. This is a very, very important and fantastic discussion we're having here. So next question I have is, how does Illinois rebuild our disability and aging workforce so all can age with dignity and independence in the home setting of their choice? Why don't we start with Representative Lilly?
Thank you. What is clear to me is transparency and accountability alone will not fix this problem. We have lack of compassion and commitment to people. And money is not going to fix it. I'm living through something in healthcare which is similar. They're paying nurses 4 times more than they normally are paying them because of COVID, and to have them to be in these settings where people are sick and on their lives are at risk. But it did not bring compassion. We have to be compassionate about people, and because we all will go this way, every single one of us, and we'll need the support and love and concern for others. And compassion is the first thing we need. The will, this whole statement didn't have the will of the General Assembly. So that means the General Assembly does not have compassion for people. And that's the reason why we're there. It's so critical that we begin to understand that we need to put ourselves in the shoes of families and patients that we are advocating for when we are making these decisions, when we are coming together and asking people to share their stories. Transparency and accountability are pretty much business terms that addresses business objectives. But when you're looking at why government exists, healthcare, nursing homes, long-term care creates options for people and persons to have quality of life with a family decision. If you ask many families, particularly the vulnerable families, they don't have that available to them. They don't have those options. So we as advocates, we as legislators, we as agencies within the government have to bring compassion and concern for others as the priority in this space, because it is a right. I think each and every one of us want our family members to have dignity and respect as you go through this, being sick or not well or aging, or you have a disability, you have mental health challenges. And we've heard over the past, since I've been, have the opportunity to chair the convening of these subject matter hearings, the families' stories are heart-wrenching. And we have to listen to the people. And I just have not seen paying people a lot of money that brings dignity and respect. I have not seen it, and I have not heard it. So we have to see this as not a business, but an opportunity, actually a commitment to our society to care for one another. And you just cannot get there when you're thinking about profit. And I have to keep going back to that. It's causing families to think we legislators don't care about them. And I hope that's not true. And from the legislators I work with, I can say that's not true. However, some of the things we do requires transformation of the mindset that allows you to really think what is going to help people and change what we've been doing, that status quo, change it so that we can exist in this world together with love and concern for others. And I know these words are, they're not the business words, and I can use those. But I'm really trying to emphasize we have to really get away from what we've been doing. COVID, I've been in General Assembly 10 years. I've been talking about this since I've been in the General Assembly. And it's till I'm blue in the face. I think I'm blue now. COVID just said, oh, everybody said, this is what Camille been talking about. And then go back to the same thing we've been doing. So I'm just really wanting everyone to understand that the families need change and reform, and it starts with compassion, reforming the mindset of the people who are in these settings or in these positions or in these leaderships. They need to begin to think differently about the quality of life and the concern for people. And I apologize for going on, but I'm in a space where I'm seeing it daily. And I think I agree with everyone. This is the opportunity to turn this around. Thank you.
Thank you, Representative, especially for speaking with such passion about this. And I think you raised some very valid points about there's a human element to this that oftentimes is missed, and we need to meet this moment with empathy and compassion. Why don't we go to President Kelly to touch on this issue?
I completely agree with Representative Lilly. The question of compassion is really one that we do need to wrestle with. And the issues in the long-term care setting are numerous. The issue of keeping or getting recruiting and retaining staff is just critical. In the home and community-based setting, it's a little different than the nursing home setting. The nursing home setting, workers don't get enough hours, if you will, to sustain themselves. And so there's some churn there. In nursing homes, the wages tend to be so low that an individual could work almost anywhere. It's minimum wage wages in too many cases that makes such a challenging job unattractive. And so we need to do a better job of recruiting and retaining folks that starts with decent wages and the ability to train and get additional skills if folks are so inclined. We really need to make sure that client matching registries and other tools are used to address this. Decent healthcare benefits, paid leave, some retirement security, and as I mentioned, career pathways. These are all the types of examples of the things that we can do that would stabilize the workforce and would have a direct impact on the delivery of care. We can do those things in the state of Illinois. The state is the main funder of long-term care in the state. And we can demand that those who seek to have for-profit businesses, that we can ensure that those workers get the type of care and benefit that they need to do the care that's needed. We're all going to, if we live long enough, need some type of care as seniors. There are hundreds of thousands of residents in the state of Illinois who have disabilities who need the type of care that a home and community-based worker or a nursing home might provide. And so it's our responsibilities, those of us who have compassion, who can push our legislators and push our government overall to do what's necessary. But again, I am more optimistic than I've ever been because I do think we have leaders in Springfield in this administration at HFS, as well as leaders like Representative Moeller and Lilly who get it and want to do the right thing. And I think slowly the industry itself is coming to the realization that they need to change. And so I have reason for optimism. We just need to keep pushing and make sure that they do what's necessary.
Thank you, President Kelly. And Representative Mueller, your thoughts on this question?
Well, and to what President Kelly was just talking about, what we heard from nursing home workers as well during the hearings that we've held over the past several months, and we need compassion for these workers. They're doing incredible work. We heard from one woman who had been working in a nursing home for most of her career, I believe almost 20 years. At times, she has up to 30 residents that she's caring for on a shift. Unimaginable workload, and the fact that she still is in this profession, speaks volumes to her personal commitment to caring for the most vulnerable, for our elderly. But we shouldn't have to rely on people doing this work out of pure compassion and empathy and dedication. They should also be making a living wage, and knowing that their retirement and that someone's going to take care of them, when they get older and need care, that's going to be there for them. These professions are mostly made up by women. It's a female-dominated profession. So when we talk about systemic issues, we see, inequities based on gender, based on ethnicity and color, and that is also part of what needs to be fixed in our system. We need to make sure that these jobs are that people are compensated based on the value that they bring to their jobs, which is nowhere near what they're being compensated right now, and that we're keeping people in these professions and not driving them away because they can't support their families, or they themselves are putting themselves at risk of catching COVID or also injuring themselves because they have to take care of so many people. So that's part of the reforms that are being the centerpiece of what we're trying to do to reform the system is ensuring that any new money that comes into the system, and we're talking tens of millions of dollars, both in state resources and federal resources, goes directly into staffing. And that's hiring new staff and keeping and compensating the staff that are there so that they can stay in these jobs and support themselves. Rewarding facilities that are doing the right thing and are staffing. And quite frankly, for those who are unwilling to abide by that philosophy and that approach to care, they shouldn't be in operation. They shouldn't. Lori Hendren gave an impassioned speech at a recent hearing, and she said, if you're not willing to take care of people in the manner in which they deserve, then you don't deserve to stay in business. And unfortunately, we've been propping up these businesses that don't operate in an ethical and moral way for far too long. So all of the reforms that we're looking at are at rewarding and incentivizing good behavior. Things that these facilities should have been doing already, but unfortunately have been allowed to exist with little oversight, and using the financial aspect of and the funding aspect to incentivize this behavior, not just the penalty coming in and having to correct problems after they've been presented. So, I think that's what's going to compel change in the system, and that's what we're hoping to get accomplished. At least starting to make the biggest push for reform this spring.
Thank you, Representative. And it looks like we have about time for one more question. And I want to send us off with this closing question here. So we have to remember the significant role family caregivers provide to their loved ones, especially those who reside in long-term care facilities. And though federal and state guidance allows visitation at all times in nursing homes, as long as the core principles of infection prevention and control are utilized to prevent the spread of COVID-19, family members continue to face denial of visitation. How can we support our 1.5 million unpaid family caregivers and protect visitation for loved ones in nursing homes? And let's go back to Representative Moeller to start us off.
Sure. So I think there are multiple approaches to that. And I agree with the premise that we should try to be supporting people in their homes as long as possible. I think from a quality of life perspective, just, ease and comfort and familiarity, people want to stay in their homes. From a financial perspective, it's a much more cost-effective approach for the state and for families. Because we're staying the amount that we put out as a state to pay for a resident in a nursing home is 3 to 4 times higher, greater than what we pay for services in the home through the community care program. So we need to ensure that we're supporting that program, which has been a real point of pride for the state since that program, the community care program, was created back in the early 80s, late 70s. Letting people stay in the home as long as they can. So we need to support that system financially, and again, supporting the workers in that system, making sure that they're getting paid a living wage and that they can continue to work in those roles as long as possible. In terms of addressing social isolation, that was a huge problem, as we heard from the mother and daughter who testified before this panel. Heartbreaking stories about families being separated and loved ones, not being able to be in contact. And having families in a nursing home is incredibly important, not just from a keeping relationships, together, but also keeping eyes on what's happening in the nursing home. Families provide a good, oversight role by being present in a facility, and that was missing, during COVID. One thing that we have tried to do, and AARP really spearheaded this effort, and I was proud to help shepherd this bill in the House along with Senator Collins in the Senate, is making sure and requiring that every facility is providing technology so that loved ones can be at least connected virtually in the event that they can't physically be connected. Unfortunately, that bill also received some pushback from the industry. They weren't. We had to. There was a lot of negotiation and education that had to go along with that bill as well. But due to the perseverance of AARP and our allies, we were able to get that legislation passed. And so moving forward, facilities will have to at least allow residents to connect with loved ones in the outside world electronically or virtually in the event that facilities shut down again. But I think we need to do a better job of making sure that loved ones can be connected, whether it's designating somebody in the family who is still able to visit, so at least there's somebody who's able to come into the facility. We need to make sure that that never happens again, where people are isolated and cut off from their loved ones.
I couldn't agree more. I could not agree more. And with that, I'd love to turn it over to Lori to talk about the 1.5 million unpaid caregivers.
Sure. Thank you. And thank you, Representative Muller, for your leadership on the virtual visitation bill. That was made possible because we had allies like SEIU, Representative Lilly, and Representative Muller championing that along with Senator Collins. But for our family caregivers that are trying to balance it all, we need to make sure when they are looking to get into home and community-based services, we're not enduring roadblocks. And it is an easier transition to getting into services. But we're also, and from a legislative point of view, we are supporting them, whether that's workplace flexibility, being able to have paid sick leave, and to be able, we have a law that if you have paid sick leave, you can use it for caregiving responsibilities. But for too many in our state, they don't even have that. So, I mean, to sound very simplistic, we need to get to the common denominators of we have to take care of our people. And if we want our aging population to stay with our families, we have to do surround sound around them and to support them, because we will all age and we have to be able to age in appropriate places. I know personally my mother was placed in a nursing home after she was hurt in a car accident. We never thought she would have to go there, but she was placed. And I know personally, I was 16 years old and I was already confronting issues that was in the facility and the poor quality of care. So we have to, as listeners and lawmakers and advocacy, we have to have the passion that Representative Lilly talked about. And we all heard her voice. We also have to have the passion to know and demand change that Senator Peters talked about. So we can do better, but it's with all of us coming together and saying enough is enough. We have to make change, and we can do it together.
Representative Lilly, how can we support our 1.5 million unpaid family caregivers?
To consider them a part of the treatment plan. Families who find themselves in caregiving positions need to be supported. More than that, families who need these types of services from the industry, from healthcare, the families need choice. Whether a nursing home is best for their family, whether serving and meeting their needs within the home, whether you are on the CCP program and you can get on the CPP program and remain on the CCP program for your family. These are all options that really reflect dignity and quality of life. I, by no means, think that, and I'm clarifying, that people should not be paid for their skill sets and their commitment. What I am sharing, and even in the caregiving space, is the business decisions are impacting them to doing the job that they know how to do. And the compassion is interrupted because of the business decisions. Yes, these professionals who have committed themselves to caring for others in these settings, they are hamstringed. Their arms are tied because of these business decisions. And I'm really, which means compassion and concern are not first and foremost. The caregiving industry, that is where most of us really will excel, because we love the people that we're caring for. And we need to support them. And so with that, we need to expand long-term health care to create the options for family members to do. If they have to I had to turn into a caregiver. And they allow me to do that as I'm dealing with my loved ones at that time in their life and doing this is their journey. And I think looking at how families are impacted by these diagnoses or these conditions and supporting them in every way possible through the caregiver, it's going to make a difference, and it's going to show you that we care for one another. So let's continue. We put a piece of legislation in place on HB 158, which talked about the community health worker and their role. And you attach them to the community care worker, or the community caregiver rather. You have something. You have two people knowing how to navigate very complicated agencies and policies, and then you have someone who loves that individual, willing to go the yard, if you will, go all the way to the end zone. You have something that's going to bring dignity and quality of life to not only the patient or the client, but also to the caregiver. So I'm looking forward to both of those legislations coming forward to support. I think very much needed resource as far as nursing home, as far as the healthcare community, as well as the long-term care community. Thank you.
Thank you, Representative. And I wish we could get all of our panelists to chime in on this question, but we are running out of time. So I wanted to start by saying thank you to Representative Moeller, Representative Lilly, President Kelly, Lori Hendren with AARP Illinois, and most importantly, all of our listeners for joining this important discussion today. We apologize if we were unable to answer your question or address your comments this morning. I'd like to give our panelists the opportunity for some closing remarks. Let's start off with President Kelly.
Again, truly was an honor to participate in this panel. Want to thank all of the amazing Representative Moeller, Representative Lilly for your ongoing leadership, and of course AARP. I think again the message for us again is transparency, accountability, making sure that workers who perform this work are at the center of it and are compensated and respected in a way that helps create better outcomes for all of us. Investing in nursing homes is fine. Folks will always want to live in nursing homes, but a deeper investment and commitment to home and community-based services will benefit all of us in the long term. So again, thank you, everybody.
Representative Moeller.
Thank you. It was wonderful to be with you today, and I appreciate being invited to be part of this panel. I am. It's an honor to work with SEIU, AARP, Leader Lilly, and my colleagues on this issue. I can't think of a more important charge that we have as a legislature to protect the most vulnerable in our state. And I appreciate, all of the passion and efforts that's going into making these reforms. It's not an easy. This is not an easy task. There's a lot of inertia. There's a lot of desire to maintain the status quo. But we have an amazing team of people working to make real changes. And I'm just very happy to be part of that. And look forward to coming back, hopefully next year, to talk about the great things that have, the changes that we've made and the better care that we can look forward to make sure that nobody has to worry about, putting a loved one in a nursing home, and people want to, people are working in nursing homes, are supported and can live, making a good wage and staying in those professions because of that. So again, thank you so much for this. And these are the kinds of conversations that truly make a difference and can help propel real reforms.
Thank you. Representative Lilly.
In this discussion forward, I think we as a unit, as a team, have really touched on all the components of what we can do together to improve the quality of life for those families who have loved ones who are aging, loved ones who have disabilities, loved ones who have mental health issues, loved ones who need options in long-term care. I believe all of us have put our heads together, our hearts together to address this issue. And I'm just happy to be invited to speak and to be a part of the solution. I believe we can. I believe we will. And I say that with love. And I thank you for your commitment to people.
Thank you, Representative Lilly. And finally, Lori, close us out.
Yep. Well, I want to say thank you to everyone that I got to share the screen with. I'm definitely not at your level, but I'm there in spirit and compassion, and I learned from you today. It's time that we disrupt long-term care. We keep saying it, but things in motion need to stay in motion. And I want to get everything across the finish line. And we have the players that are going to make it happen. But most importantly, you, the viewer, you, the family caregiver, it is going to take a tsunami of voice and passion and drive and openness to be able to make this change. We're at the cusp of it, folks. And I think this is so great that we're here together, but we have the ability to do it. So in the end of this summit, you could join with us and join this coalition, join the movement. And because we want to hear from you, we want to educate you, and we want to learn from you, because all of us together as a united voice can truly change the tide on how we age and the inequities of care that people have suffered and continue to suffer, improve the workforce, enhance it, paid leave for those who care for us. And more importantly too, not more importantly, but we can double down on the resources in home and community-based services. So no one is put in that horrible situation of having to choose, do I have to cut back hours at my work, or can I be able to swing financially, put my loved one in a nursing home? Enough is enough. So thank you, Josh. Thank you, you fantastic individuals that are joining us, and our panelists today. This is not possible without you. So thank you for letting me join.
Thank you, Lori. And as Lori echoed, thank you to our distinguished guests. Thank you for taking time out of your very busy schedules to join us for this very important discussion. Stay tuned as we are continuing our live Disrupt Long-Term Care Summit session, the roadmap to disrupt long-term care, as we navigate through these unprecedented times. And thank you all for joining us today. And this concludes this session. Please stay with us live on your current virtual link.
Hi, my name is Lindsay Sullivan, and I was a nursing facility resident for over 7 years. Because home and community-based services is where people can, people are comfortable. People can be well. People can, be, attended to one-on-one or in like a family situation. And, they don't have, I don't have to, with a person who has a caregiver, I don't have to worry about, someone being stretched between 3, 4, and 5 rooms, and then having infectious disease is transferred between, myself and another person. And having to worry about, is this person going to be too busy to help me? No, this person is here for me and me alone.
Hello and welcome. My name is Steve Anderson. I'm a former state rep and a former Illinois Human Rights Commissioner for the state of Illinois. I'm currently a licensed attorney, and I focus a lot of my practice in the area of elder law. And most importantly, perhaps for this discussion, is I am an AARP Illinois contract lobbyist. So it is an honor to be here and to be the moderator for today's next session. I think we need to do a technological check to make sure all of our people are online and ready to go. So if I can hear Representative West, can you say hello? Just for a voice check? I don't think I can hear you. Teresa Collins?
All right. Yes. Hi, Steve.
There we go. Allie Johnson?
Hi, Steve. Hi,
Allie, can you?
everyone.
There we go. And Carrie Leljadal? Is that the correct way to say that?
Hello, it's Leljadal, 3 syllables.
Leljadal. Very good. And Maurice, can you,
There you go.
test again?
Yeah, can you hear me now?
Yes, perfect.
Can you hear me now?
Wonderful.
Okay.
Yes, we can. Awesome. So I'd like to welcome everyone to this important live virtual Disrupt Long-Term Care Summit. You're joining us for the final session 3, the roadmap to disrupting long-term care. Today's virtual Disrupt Long-Term Care Summit would not be possible without collaboration with our coalition members, the Service Employees International Union, Access Living, and Alzheimer's Association of Illinois chapter, and of course AARP Illinois. If you would like to ask a question anytime during this live summit session, please post your question or comment in the chat box, and we will be addressing or attempting to address all questions and comments throughout the session. Today we are live with our leaders in state government, aging services, and a respected family advocate for Illinois caregivers. I'm honored to welcome for you to today's panel Representative Maurice West, Teresa Collins, CEO of Senior Services Plus and Executive Council member of AARP Illinois, Allie Johnson from the Illinois Department of Human Services. I'm not a very good moderator today. Olmsted Director, lead on the Williams-Colbert consent decrees, and Carrie Leljadal, State Spokesman for Illinois Caregivers for Compromise. To read more about our incredible panelists, please click on their bio links to read their respective bios. And throughout this discussion, please refer to the handouts to feature downloadable critical resources the Coalition has made available to you, the viewer. Now, we've introed 2 robust sessions on enhancing and sustaining Illinois' home and community-based services and what must be accomplished to end the inequities of care for Black and Brown nursing home residents. Now we're heading into a different aspect. We're heading into the blueprint for the future, because it's one thing to address the problems of the past, it's another to move forward. And that's what we're here to discuss today. So I thought we'd start with a discussion about the workforce, because obviously none of this can get done without individuals willing to help and willing to participate in workforce and workforce development. And we know that if we do nothing, the eligibility and the numbers of persons seeking in-home care is going to increase. We know that. Though providers face an uphill battle in filling those critical frontline positions. We all know that there's difficulty finding and recruiting eligible and quality care. But here's the difficulty. Job seekers who are out there can find higher hourly wages, expanded benefits, and overall job comfort, perhaps greater, at a retail store, believe it or not, rather than employment caring for our most vulnerable populations in long-term or in-home care settings. So if we could start, I'd like to ask our panelists each to comment on the concept of how do we attract and how do we develop strategies to attract, train, and retain a more skilled workforce for nursing homes and home and community-based services. Representative West, why don't we start with you?
All right. Well, first off, thank you for this opportunity to be here with you. And you nailed it on the head in terms of the issues that we're facing. And one thing that I say everywhere I go, and I'm glad to be a part of this panel when it comes to the future, looking ahead and not just what's behind. With us going in this pandemic and eventually going into a post-pandemic normalcy, we can't go back to the ways of old. Matter of fact, we owe it to the people that, the legacy of the people that were lost through this pandemic to be bolder, faster, and stronger in terms of everything that we deal with. And so when it comes to long-term care, we have to make sure that we look at this differently. One thing that we need to do, I was proud a supporter of increasing the minimum wage. However, I had conversations with a lot of individuals who, within the long-term care facilities, that their fear is that their workers will find better jobs at McDonald's, or as you said, retail, than they would within the nursing home that they worked at. And so what we have to do is specifically prioritize long-term health and how we can make it a more enticing industry to be in. If we take care of the people who work in it, they'll take care of of their patients. There'll be a higher quality of care for our patients. And that's just psychology 101, business psychology 101. So we really have to focus on the incentives, the benefits, the increase of wage that for our long-term healthcare facilities and for our other special care facilities, such as those that focus on those with special needs. And so that's what, as a state, that's what we need to partner with individuals that are on my panel, partner with you to figure out what's the best way to do that and let that be the focus and go from there.
Wonderful. And thank you for pointing out the importance that not only from an employment standpoint, not only does that benefit the residents, but it also benefits those employees with a high quality of life that they get to enjoy. Ms. Collins, any thoughts?
First of all, thank you. I'm just honored to be here today. You know, we've heard from our previous spokespeople about the crisis level of our workforce. And I can tell you in 15 years working at a direct support provider network and agency, I've never seen the workforce shortage and crisis like it is in both recruitment and retention. And so I wish there were, a one size fits all answer. I wish we could say, here's a best practice. Here's how we solve this. But in the years we've been working on this as it's been coming about, we know that there's not. I think, Representative West mentions that we previously competed with our own selves, agencies like our own who provide this type of work. And now we're competing with other industries. So what do? We have to create a wide network, cast a very wide net when we're now recruiting. And so while word of mouth from our current employees used to be our best practice, that's not enough. And I think these employees, like all other employees in all industries, deserve some things. That's good communication from their employer. They also need to have sensitivity around their availability, looking at their schedules, and we have to now learn to schedule around the caregiver's needs and their work and life balance. We also can focus on the benefits, and while pay is something that's definitely top of mind, the benefits and rewards that this work brings are just immeasurable. The relationships that these caregivers build with their clients and with these clients' families are some of the strongest relationships you will ever see. But that too is not enough. We have to pay a livable wage and not just minimum wage. This is not minimum wage work. This is not entry level work. This is not work that anyone can do. This work requires a very unique skill set and person to do and do well. And the individuals who are seeking care deserve that quality of service. And so we have to build a better network to get these employees in the doors. Maybe we can work to build a career path. One sample we are looking at our agency is just that: a new caregiver, then an advanced caregiver that has some sort of specialty training or certification, maybe dementia or Alzheimer's training or certification. Then a caregiver mentor who is mentoring new caregivers who come into agencies, because this is, again, not easy work. A caregiver supervisor next level, and then eventually becoming part of the office staff. Again, there are many steps to enhancing and strengthening our workforce, and these are just a few.
Thank you for that. And also, thank you for recognizing that it's more than just the money. Of course, it has to be the money, but I think that there's a lot of personal reward that can come through this. And thank you for those interesting suggestions. Ms. Johnson, you come at this from a slightly different approach, which is we're looking or we're talking about expanding hiring, but your role is actually to make sure we're hiring the right people, or more importantly, not hiring inappropriately. Can you comment on that briefly?
Yes, absolutely. Thank you so much for allowing me to join this panel and speak on behalf of, what the Department of Human Services and what the state of Illinois is doing, and with my unique role related to ensuring that nursing facility residents and individuals who have been unnecessarily confined to long-term care facility settings have the opportunity to live independent lives in the community. Home and community-based services staffing is so crucial. I acknowledge that it is a crisis right now, as the previous panelists had said. Staffing shortages are at an all-time high right now. Behavioral health services are really struggling right now. Homemaker services, in-home caregivers and nurses and CNAs that are responsible for helping individuals stay and be successful living in the community. And so it's going to take an all hands on deck approach. The state of Illinois, the various agencies who are the regulators of home and community-based waiver services, the Department on Aging, the Department of Human Services, Healthcare and Family Services, all of us are coming together and engaging with various stakeholders like yourselves in order to brainstorm how can we actually address the staffing shortages. As was previously mentioned, the funding increase pay is not going to be the only solution. It's absolutely necessary. And I really look forward to seeing increased wages, especially through the Americans Rescue Plan funding that's going to be coming and addressing low funding for home and community-based waiver services. But we also need to address the work environment of these individuals. Are they granted the flexibilities that they need in order to work and have a stable home life? Are they actually engaging? Is their employer providing self-care opportunities so that they can support themselves, remain stable and happy and engaged in their work life and not burnt out by their work life? Those kinds of strategies are necessary for the state agencies like the Department of Human Services and others to really brainstorm how we can adequately address. Many agencies are engaging in cross training of different staff, making sure that all of these individuals going into individuals' homes can actually provide the various services that an individual will need to be safe and successful in their home. So brainstorming different ideas with the stakeholders, with the consumers of these services is so, so crucial, because funding and increased wages, while important, is not going to be the only solution.
Sure, and thank you. And I like the idea of brainstorming, because if we're being genuine about our idea of disrupting long-term care and moving more people into a hopefully better circumstance of home and community-based care, we're going to need to expand those, right? That it's going to have to be more robust. We can't simply say we have what we need now and it's all good. Um, uh, Ms. Laljadal, and that sounds kind of Swedish. I'm a Swede. I don't know if that is, but it certainly resounds for me. What are your thoughts about this and about how we address this issue?
Well, thank you for having me today. I think we need to start by putting value on the residents' lives. We don't teach society that whether you're talking about an adult with a developmental disability who could spend 50 years in a long-term care setting, or somebody's mother or grandmother who is also in a different type of long-term care setting, we don't teach society that they still have value in their life. They are not, we don't let people go live there to end their life. We were supposed to put them there to enhance their life and to improve their quality of life. So without teaching society that there are ways to make their life better, who would want to go work there? Because all they see is the end game and not the beginning. Um, my son lives in a facility that is very different than most. We actually have over 40% of our staff is been there for more than 5 years. And we're talking about a facility that employs 150 people or more. They work at a resident-centered level. And we have both skilled nursing and intermediate care adults with developmental disabilities. And the staff in our building is part of the residents' lives, whether it is they're planning an outing together or, when unfortunately if a resident passes, the staff is given the time they need to deal with that emotionally themselves. Our facility made sure that through COVID, our staff was taken care of. Yes, money's important. The raises were important. Combat pay or whatever you want to refer to that as, that was all important. But even more important was making sure at the end of the day that somebody asked the staff, "Are you okay? Can you get through today? And can you come back tomorrow?" We have to put value on those that are caring for our loved ones. And value is not just money. There's lots of ways that it comes. Money's important. Training is important. We need to make sure they have what they need to do the job they're trying to do. How frustrating is it for a staff person who is sent in to care for somebody, but nobody showed them how to properly transfer that person? So we need to go more individualized. We need to make sure that family is part of training the staff, working with the staff, using a family-centered approach. Bringing this family and the resident and the staff together is going to make everyone's life a little easier because that family is going to be able to teach you the things that somebody else couldn't, because I know how my son is going to transfer, or I know, that my grandmother will not eat that, but if you let me spend time with you, you're going to learn these things.
That's wonderful, and thank you for those observations. And actually, that I'd like to transition a little bit into that. So, Carrie, if you're willing to speak on this next topic, we also talk about workforce, but we also talk about caregiving. And when we're talking about that, we're caring for a parent or a spouse or a child or another loved one. That can be a 24/7 job for those people. It's emotionally, physically, financially challenging, and our state needs to support our family caregivers and strive to make their significant responsibilities a little easier. Research that we have reveals that we are experiencing a real collapse in the availability of traditional unpaid family caregivers. Think about that. Unpaid family caregivers, people who are there simply out of love. In 2010, there were 7 potential caregivers, somewhere between 45 and 64, to help every 80-plus-year-old likely to need care. By 2030, the estimate is there'll be 4. For where there used to be 7, there'll be 4. So as life expectancies increase and fewer of those people in need have a family to help them, demand for caregiving services will continue to explode. The cost of such services will continue to explode and soar. How can Illinois better support and acknowledge family caregivers in our state? Is it things like the visitation? Is it respite care? Is it paid sick leave? Is it workplace flexibility for those family members? Carrie, could you opine on that first?
Actually, a little bit of all of it. My son, when he was home, we had paid caregivers that were in our home. At points, my husband and I were technically also, we always provided lots of unpaid care. There were points we were able to provide limited paid care, but there's not enough hours. There's not enough support trying to make your house or your vehicle accessible is, even though there is funding out there for it, it's almost virtually impossible to find the funding because there is no network for these family caregivers to even know where to start to look. The pandemic showed how much care family members provide in long-term care. We are there, we help bathe, we help feed, we help do every task our loved one needs. And when you took all of us out and locked us away, we saw residents dying from failure to thrive. We saw an expedited rate of death of people with Alzheimer's and dementia. We saw a cognitive decline with adults with developmental disabilities. At a minimum, we need an essential caregiver's law to protect residents of long-term care, to make sure that their loved ones, even if it's just one or two people, are never locked out if we have to shut a facility down again. There is federal legislation that's been introduced. There's state legislation that's been introduced. We couldn't even get our state bill heard here in Illinois. I can tell you from a family member, from a parent, and that's, where my story is different. I am a parent. I was over 4 months without physically laying eyes on my son, without a window between us. That is not a visit. We need to make sure that the family members to help be part of this are treated as valuable as a paid staff person, whether they are paid or not.
Thank you. And as you pointed out earlier, the paid staff can do a better job if they have that interaction with the family, so they know the specifics of that particular person. Is that a fair statement? So
Absolutely.
let's move on. I'd like to also. I'm sorry. All right, I'd like to hear other thoughts on the same concept of. Okay, I think we're getting a little lag or a little issue with the sound, so I apologize for over talking anyone. Maybe we could have Teresa, and I hope it's okay if I call you by your first names. That's just how I work. So Teresa, could you give us your thoughts on this important issue of these home care or volunteer caregivers?
Yeah, 1 in 6 employees in the workforce is an unpaid caregiver. So this is a serious issue. So things like we've talked previously about schedule flexibility, paid flex leave, not just sick time, but flexible time that can be used by employees in all facets and workforce areas. But I think Ellie brought up something to expand upon in this area, and it's really looking at the well-being of the family caregiver. And so while those things, that employers can offer are important, so are things like sharing resources, like providing EAP services for mental health, offering a holistic approach, yoga or meditation resources, also a toolkit to your employees about food delivery service, how to set up auto bill pay, where to get grocery delivery. Because as a family caregiver, an unpaid caregiver, our time is our most valuable resource. And there is not enough of it in any day. AARP put out some resources that we as an employer use. If you visit AARP, the first is a toolkit for supporting caregivers. It's a guide for employers. It's a great guide. It's a starting point for employers to review, get some resources, and start to put a caregiver friendly work environment into their work. Also, another tool, a manager's training, how to build a caregiver friendly culture. This has to be a top down approach. This caregiver friendly workforce has to permeate down, and we have to know that this is not going to go away. Family caregivers, unpaid caregivers, while you mentioned those are going to be reduced, the numbers available, we are going to see them continue to, because people want to age in place, people are living longer, and people want to take care of their family in a way that they know is going to be appropriate and right for that individual.
Maurice, Teresa mentioned the idea that this is a top-down approach. Well, my friend, you are the top. You are the legislature. I know there's that. I'm a fan of the legislature. So, what do you think? What are things that we can do to the issues that we just heard about for these family caregivers?
Yeah, the issues that we just are were spot on, and I really support what I've heard. We need to get away from just relying on caregivers to be in this position out of love. Or we have to we have to support them and appreciate them by paying them, and not just keep them unpaid. And this helps not just the family as a whole, but it helps the community. It helps our state as a whole when we really focus on this. And so again, be a broken record. We have to do things differently than we did before. This is the future. This is something different. And so, being the top, since you said I'm the top, my job is to listen to the subject matter experts who are the panelists on my panel, my fellow panelists right here, to find ways where they can support and show our support and make things better, because that's what government is supposed to be about, helping people. Well, this pandemic and has exposed a lot of discrepancies that we need to fix. And it's time out for negotiations and meetings and conversations. It's time for plans of action. And so those at the top, they need to make sure that they're in the trenches with to understand what's going on, so that we can make a difference. Another thing to add to it, is because I call it the spick and span approach. Every time I go to a long-term health care facility, where it may be, every time I go, I walk in, I can smell the spick and span, they clean it up for me, and they put their best foot forward. But talking to afterwards, they were able to share what it really was. And so it's important for us even to talk with staff. It's important for us to show that they are valued by listening to they're going through and how can we help you and how can we make this better. Respite care is great. Paid family leave, paid leave is great. What else can we do to help you? And it's because and we're in the position of power to make it less talking, more listening, so that we can get to a plan of action. That's what we do at the top.
That is awesome, and that's important takeaways, at least for me, from a summit like this. Is you the leaders get to hear from these experts, and I'm so glad that we've had this opportunity. I'd like to shift to a different aspect, which is the question of consent decrees. So this is really for Allie and Teresa to opine. But if you could you discuss the nursing home diversion efforts under the Colbert and Williams consent? And for the listening audience, if one of you, maybe Allie, if you could briefly explain the decrees and how they impact residents, what's happening now, and what are the barriers we have to address?
Absolutely. So this is a topic, that I have for almost a decade of my career, and I am in full support of the mission of Olmsted, which some of you may be familiar with the Americans with Disabilities, which really is the genesis for Olmsted decrees across the United States. has 3 Olmsted consent decrees, 2 of which are Williams and Colbert consent decrees, which afford individuals who are unnecessarily, potentially unnecessarily confined to Cook County skilled nursing facilities or the state of Illinois specialized mental health rehab facilities the opportunity and live independently in the community with the necessary supports and services in place so they can be successful. The Williams and Colbert consent decrees have been around in the 10, 11 plus years, and there's still a lot of challenges in place to make sure that we have really rebalanced the system. There is more opportunity for community-based living as opposed to institutional based living when it is choice. Our Williams and Colbert consent decrees afford the state the opportunity, but also is a requirement as they both against the state of Illinois, the requirements to transition a certain number of individuals from institutional care to community-based services with the service. So we are really working on with a cross-agency approach. Public Health, who is the regulatory agency over these long-term care facility settings, Healthcare and Family Services, who is the supporting these individuals in institutions, and then after they transition to the community, the Department on Aging, who specific our aging population in the skilled nursing facilities, and the Department of Human Services, who serves as the lead agency for the consent decrees and programs with community providers who are entering into these facilities, assessing individuals, what their needs are, providing the care planning, transition out. A lot of our programs provide rental assistance because we know that that is a huge challenge. Finding affordable housing, be a topic a little bit later. Affordable housing is so limited in the state of this country. And so rental assistance is so necessary and a key aspect of the services being provided under these Williams and Colbert consent, but also the home and community-based services. There needs to be an increased amount of investment in services away from long-term care facilities in order to balance the systems so that individuals who are living with and that is in the community. I realize that many in attendance today may be familiar with Money Follows the Person, MFP, which was a previous initiative in Illinois, which I believe ended several years ago. And at this point, I do not know of any plans of regaining MFP. The Williams and Colbert consent decrees follow the same mission of what MFP stood for in the state of Illinois, and integrating individuals from long-term care facilities to independent living in the community. But the state of Illinois has achieved over 4,000 transitions to the community in both cases. Both decrees were implemented 10 or 11 years ago. And we still have a long way to go and in making sure that individual in these facilities are afforded this opportunity, which is their right.
Wonder much for that. Teresa, can you add to that discussion?
Steve, we talk about this opportunity, these consent decrees, and the state's responsibility, but there are hurdles and roadblocks. While it is important for people to be able to live and age in their choice and avoid premature facility placement or unnecessary placement, we have to then not just home and community-based services that we've talked about today, like homes, but we have to ensure that if individuals are going to come out of placement, that all of the things necessary for them to be successful and be part of the community are in place. So things like which Ellie mentioned are very important. And the state of Illinois is unique. Some states across the nation, the needs are the same wherever you go statewide. But in Illinois, we have very rural, very, very suburban settings. And so the needs of individuals based on geographic placement have that. We have to look at accessibility to transportation. We have to look at accessibility to care and expert medical care, not just general medical services. We have to look at other resources and how things that a lot of us take for granted, getting food, a basic life need that has to be met, access those things if they are so fortunate to be able to go back into the community. And it's our response to come together to ensure those things are happening statewide. We've got a very robust provider network, but with this, because one thing I think one of the panelists mentioned on us is that things have changed and the needs change over time, and then again based on geographical region.
And thank you for that. And I think it is important. We're talking about a state that is very different in its geography. It's one thing to talk about transit issues, which are important, Chicago and in the suburbs maybe, but that's an entirely different discussion south of it. So thank you for pointing that out. Allie had mentioned the idea of housing. We're talking about home and community-based services. Obviously, housing would be the first H in that. The number of adults and older in Illinois is growing at a rapid pace. Today, many communities are not prepared to address their numerous needs. Increases. Older adults and their families will need quality, affordable, accessible housing, care services at home and in the community, and to live in neighborhoods, like I just said, with reliable transportation services and facilities, bike trails, finding healthy food options. Implementing policies of affordability, accessibility, supportive services are vital to actions for our elected and appointed officials to take this step. Can you discuss solutions or thoughts you have about this? If I were to put an overarching term to it, how do we age in place? And why don't we start with Carrie to talk about that?
So it's accept because of how the needs change as they age. So being able to keep them in place means a much more fluid system that changes with it. I mean, the community, and I'm 2 blocks from my son's facility, is a community of 75. We are in Southern Illinois. We are rural. So there is no mass transit. There is no food. There is no doctor directly in our community even. So those needs are going to be met when somebody is outside of Cooks, let alone if they're in Cooks County. How can they afford to do that? So yes, it might be a little more affordable, but the resources aren't there. And you go up north and the resources might be there, but the affordability is. So we have to find a way to make all of that happen. How is somebody that is in a facility supposed to try to save to come home and maybe get themselves out when they're only allowed $30 a month dirty? So, we have such a system that you hit a brick wall no matter which way. That first we have to figure out, how do we get rid of the brick wall to even go forward?
Thank you for that. And yeah, that's a real Hobson's choice, right? You can move to an area that's less expensive. You can't get the services. Maurice, thoughts?
Yeah, this is a very great question, and I'm really excited. Legislation that I'm working on as we speak. Steve, you will understand to get back to me, but Legislative Research Bureau. But for the past 6 months, I've put together a working group with the Centers of Independent Living to get funding for home modification so that people can stay home and won't be trapped in their home or nursing home because the accessibility is not there in their homes. Oftentimes, I'll speak from my know of family members and people in my church that had home because they couldn't get up and down their stairs of their house, and they wanted to stay home. Do it, and so putting together funding so that individuals can receive to modify their home so that they can have a ramp, so that they can get the bars in the bathroom, or so that they can stay home and be empowered by living independently, is what I'm working on as we speak. And this is something that will affect not just those of the physical. It helps our baby boomers who are now becoming are getting up and needing assistance in some way, shape, or form. So that's a bill that I'm working on, a bill of mine that I'm hoping to get passed, and I'll be working hard on it starting next month, January 4th. But it's things like this that can help us in that regard, people to stay home and helping people to be empowered when they get home and have the assistance when they are at home. And it helps them and naturally, it helps them to heal even more and just get into a position where they're physically better when they are common with, when they're around loved ones, when they are able to stay into the home that they spent 40 years in. How can we help them do that? Again, government is possible. And so I'm really excited about working with the Centers of Independent Living. I would love, as a part of that discussion, has been part of that discussion for the past 6 months. And so I would love not only for the support of individuals who have a great idea, but if you have any other ideas, let's work on it. Let's time out for allowing our seniors, our individuals with disabilities. It's time out allowing. It's time for them to have a seat at the table on how the government can help them and prioritize what need there and how we can be of assistance. So that's what I think could help. That's one step forward. Now it's not the end. It's one step forward in housing.
That is for bringing that sort of a bill to the floor, hopefully for discussion and vote. You, as one of the very youngest of the baby boomers, appreciate the things that you mentioned and the ideas of allowing people to age in place. Teresa, any thoughts on that?
Representative West's bill and look forward to seeing that. I also was encouraged earlier when Director Barry, the Deputy Director at the Department on Aging, talked about some of the innovator looking at. I think what we have to do is reassess and we have to continually evaluate our waiver services, these core services, in-home care and home delivered meals, adults and EHRS, emergency home response systems are critical. But as we're seeing here today, other low cost things like repair and modification of one's home so they home or age in place in their home. Very important. Access to food. We talk about food insecurity and problem in our senior population. And there is that sometimes just seniors or fear of being a facility that prevents them from coming forth and talking about these issues. And so I have to be willing to acknowledge these things and make these conversations part of our daily. Also looking at innovations and technology. So while one-on-one interactions and create socialization with individuals who are living in their homes, in my I'm looking at seniors, but technology, and it can be a little scary and not tech savvy. But if we can utilize some of those things that are available, minimize the work that paid caregivers having to do in the home, time and travel by accessing telehealth, utilizing and assistive devices like pill dispensers for medication reminders. A smart refrigerator keeps a running list when you're low on certain food items and can go through your Google Home Mini and create a food order to be your door. These a little bit out of reach, but these things to us now. And if we start accessing them and utilizing them in for everyone.
Thank you. I had not thought about that idea of using a Google Mini that way. That is innovation that I think it's of benefit for all of us to listen to and hear. Allie, my question for you is, as we talk about housing and we talk about aging, how much of a challenge is that? As you talk about the consent decrees and trying to get into the home and community-based atmosphere.
Yeah, it is a huge challenge, under the work of the and making sure that individuals can age in place once they transition to their from a long-term care facility setting is so crucial. What we have implemented decrees is the opportunity for funding for assistive technology. I was really pleased to hear Representative West and the bill that he is pushing forward to be that could be a really incredible opportunity for the broader populations. We have found the services of the consent decrees, assistive technology, home modifications, as Teresa mentioned, all of these different unique approaches to in the community through different technology and devices is so crucial to allow for aging in place. I'd also like to add that we need to diversify the housing that is available for our aging. If their home is no longer suitable for them, or they would like to age to their families for support and comfort, and for end of life stage, accessory dwelling units are a great opportunity for our aging. But we see that there are a lot of restrictions, zoning restrictions. There are a lot of advocates who oppose local public hearings to prevent accessory dwelling units or certain affordable developments for our aging populations. So we need advocacy so that there is more affordable, accessible housing for our nations in the areas that they want to live, whether that be by family, local grocery stores, or wherever it is they choose to live. And in their current home, the funding has to be available for modifications, for their home to be made accessible, and for them to access the devices, equipment, materials that will be needed in collaborating community-based waiver services.
Wonderful. Thank you for that. As we transition to our last topic, for-profit nursing homes, I do want to make, again, a thanks to all the session. As an attorney who's practiced in this area for 30 years, I have never I'd like to be in a nursing home. They don't want to be there. So talking about and exploring where people can live and age, gracefully is really awesome and important here. So thank you for those. So the last question I have is about for-profit nursing. So rather than looking at what is the right thing to do for residents, too often for-profits look to profits first. This is accomplished in a lot of different ways, sophisticated. For example, by paying for rent, goods, and other services through related entities, business entities. They may not be the same entity, but they're related. Companies that are wholly owned or partially owned by a related of the person who's running the nursing home. Though this is at this time, watchdog groups say this is a widely used business approach that permits nursing home excessive profits by overpaying their own companies, and that most importantly, more transparent. This business directly impacts the residents' quality of care and health. If you could you please discuss for us this for-profit that's used in the nursing home industry? You think this is something in Illinois and what we could do as far as transparency and accountability on that? Carrie, could you start us off on this one?
We need to start with more accountability, more audits, and that the audits, and their books must be done by a party and not by one of these related companies. These facilities run on money. The state is paying them to provide a service. Accountability of where are you spending that money? How are you spending? Whether it be, a staffing rate, a mandatory amount of staff per residence that is understandable, instead of this formulary that nobody can even come close to figuring out, are they actually using it or not? Even with like the COVID money that places, and we know the massive amounts of money, why weren't they held publicly did with that money instead of just lining pockets? Those things would make a huge how the residents are cared for each and every day.
Thank you for that. Any thoughts on this idea? Sometimes it's called vertical integration, where the companies are vertically integrated to hide profits.
Discrepancy between
Who was that one
for-profit
for?
and not-for-profit.
I think we're having a little audio issue.
But there are other discrepancies between for-profit and not-for-profit. I think it's important to point out that not nursing homes statistically have less resident antipsychotic drugs, physical restraints. For-profit nursing homes also have lower hospitalization rates, higher discharge rates to home. Not-for-profit homes also show more higher staffing and fewer through IDPH, more spent on care and food per resident statistic in the for-profit nursing setting. Now, this is not to say every nursing home or every not-for-profit nursing home is. These are just statistics we need to be aware of. Happy when AARP put out their nursing home dashboard found on aarp.org. I think it's a resource that everyone, whether or not you plan on utilizing a nursing home or have a family member who, as community residents and concerned citizens, we all should be looking.
Thank you. Right, we are running low on time, so I would like to thank all our panelists, Teresa, Allie, and Carrie, and most important, listeners for joining today's discussion. I think it was very valuable, and I hope for everyone else. I would like to allow each of our panelists to remarks. So if we could start with you, Representative West, that would be great.
All right. Well, I want to just thank you all for this opportunity to talk with you and to be a phenomenal panelist. It's always great to not be the smartest. I'll give the credit to Teresa, Ali, and Carrie. Thanks for all that you all, your perspective roles and your in this arena. Again, government is all about helping people. And I often tell people that I work with that I'm, as a representative for the state of Illinois, I'm simply a show. If you need me to go right, I'll turn right. If you need me to go left, we'll turn left. And this, when it comes to that example, when it comes to long-term care facility, to bring forth real reform and a benefit to our community members, I'm willing to work with every single one of you. It's very, when I'll use you, Steve, for example, you said you were 30, you did phenomenal work in the General Assembly, and just for you go to a nursing home and not have the best quality of care, to prioritize our seniors. We need to prioritize those facilities and give them the best quality care possible. For our for-profit institute, focus on their bottom line, then on the people that they care for. There's a special place in the afterlife for you that's not going to be beneficial. Our patients is the top priority, and if that's not, you need not. So that's my focus. Looking forward to working with every single one of you on reform to long-term care.
Thank you so much. Teresa.
Again for the opportunity to be here today, and I think it's great, that we're having this AARP Illinois for bringing together such an illustrious group of presenters today. But the conversation doesn't end here. Representative Lilly mentioned that for 10 years, these are discussions that have been had. 10 more years or longer, we can't be to face these issues head on, and I think we've got a great start here today.
I couldn't agree more. Allie, if you want to say a few closing remarks.
Sure. Thank everyone for this opportunity. I thank AAR and for putting together and fostering such and to have an important discussion on disrupting law. While my work with the Williams and Colbert consent decrees for the state of Illinois, small piece of that pie, I think that the state of and grow as a result of those consent decrees to influence for better change. And it is to support all populations, all individuals living in the particularly of their choice, and whether that be close to family or friends or aging in place, in any kind of that they choose, they should have services and the supports that they absolutely need. I really appreciate the other panelists and their expertise and innovation and their drive behind a lot of these efforts and initiatives go. But as Teresa said, this is an excellent start to the conversation. Hope it continues with a lot of different stakeholders, and a lot so that we can effectuate change and change. So thank you again for this opportunity. I am humbled and looking forward to engaging in future discussions.
Thank you. Carrie, can you finish us out?
Thank you for having me. The eye-opening experience today. Forward of how do we fix some of this and disrupt long-term. We need to keep the resident and the resident's family focus. That we're here to help both, whether it is in a facility or getting a community-based program. Neither one of the two can do it without. So we need it to all become much more of an approach for it to work. I've never understood why the adult developmental skilled nursing, why they don't use a family center. They're leaving out one of the most important components, residents' life, is that family member. It's why pediatrics works so well, because they use a family-centered approach. The other thing we need to look at is accountability in Illinois. We need to make sure agencies that are supposed to be governing their job, and they are doing what they're supposed to. There's a lot of issues and concerns with that. Very little accountability currently goes on in Illinois with that. But I thank everyone for letting me join you today.
And thank you all as we continue our live Disrupt Long-Term Care conversation between SEIU, AARP Illinois, Association of Illinois Chapter, and Access Living. All again for joining us today. This concludes this session. Live with us on your current virtual link.